beautiful Sunday afternoon. It's a little bit cloudy on the outside, a little overcast on the outside, and we're nice and cool in here.
You are the God that healeth me.
Okay. Yeah,
Sing it together.
thank you, Elder Colley. And we're a little bit behind time, but I want to welcome each and everyone here this afternoon. I'm happy to see a gentleman sitting there. We have a presenter, we have a pastor. We're hoping to see more gentlemen. It will be streamed, so hopefully more of our men will connect at a later date so they can benefit from the information. I'd like to welcome each and everyone to this program this afternoon. Those who are visiting from the community, I'd like to welcome you, persons who are not of our church. You may be visiting from other churches. We welcome you wholeheartedly, and we trust that as the program proceeds, that what we're expecting that we'll receive in terms of the benefit will be received, and we will be able to go and share with others so that we can make our family lives much better. We thank you for coming. We want to welcome special guest presenters who are here, and we trust that we'll have a wonderful time. We'll now ask our pastor to come forward. Thank you.
Thank you very much, Elder. It is my privilege this afternoon to extend greetings to everyone who has come out this afternoon and those who are joining us online. We are grateful that you have taken the time to be a part of this very special symposium as we look at the issue of menopause. And this is a threshold that women who live past a certain age will have to go through. But we believe that with education, with information and empowerment, that no situation, regardless of how determined or prevalent it might be, cannot be handled. And so we are here to be informed, to be empowered. And it's important as well that even the men be informed also, so that we can know how to relate to ladies when they are going through these difficult times. And I'm sure the ladies will agree with me. I got an amen. Beautiful. So it's a very important subject, and I hope the sessions, we know that the sessions today will bring about quite a bit of information, empowerment, and also will help you to become more confident, knowing too that you are not alone if this is your reality at the moment. And that's very much important as well. And so we welcome you and we greet you in the mighty name of Jesus as you have come for this session. You see, the church is not just a place where we are educated about the Bible. We are also educated on life, because we have to live life between the mountains and the valleys. And in the midst of that, we deal with issues such as menopause. And it's important to be informed on this issue. And so at this time, we're going to begin with prayer. And it is my privilege to pray for the session. So I'm going to invite you just to stand to change the atmosphere just a little bit. And then we will have prayer. Father in heaven, thank you for your wisdom. Thank you for your blessings. We are grateful for the coordinators of this initiative who have put together this program, from the women's ministries, the family ministries, and the men's ministries of this church. It is because of your leading why we are here, we do believe. And we pray that this session will result in great empowerment, and that for each woman who comes through this program, they will leave with a sense of direction, a sense of clarity, confidence, and a little bit more hope in this difficult period of the menopause. We thank you for your leading so far, and we pray that we will sense your presence. This is our asking in Jesus' name. Amen. Amen. God bless you.
Good afternoon, everyone.
Good afternoon.
All right. Can I see some smiles? You look a little tense. All right. Yes, we're here to talk about menopause, but we can have a good time talking about it, right? Huh? You're going to talk to me, and we're not going to be up here by ourselves. Okay, very good. So I just want to join Elder in welcoming you this afternoon. We're so happy to have you. We're happy you're here. And since we're talking about menopause, can I see a show of hands of the persons who knew where that word came from? Is it a pause on men? What is it? What does it mean? Anybody? Yes, you agree with me? All right, I don't think it actually is, but it has some Greek connection. So the men's part of the word, both parts are Greek, and the men's part means month, and the pausis, I hope I'm getting that right, means cessation. So it's a cessation of the monthly cycle. That's what the word means. And it was popularized by a French physician in the 1800s. So now you know. All right, Sister Cheryl, why are we here today?
Okay, so as has been mentioned, menopause, this hot topic. Interestingly, last Friday, yesterday.
Oh, you got it, the hot topic. Oh. Okay. Just checking.
You just
okay.
got it? Okay.
No, they got it.
All right. So last Friday, that's the 18th of this month, it was celebrated as World Menopause Awareness Day. So it's quite fitting that today we are focusing on this topic. Now we have some wonderful experts here with us this evening, and like I said to you before, they will be focusing on this very hot topic, will be empowered. Now, I'm sure that all of us here, you know at least one person who has had struggles with issues relating to menopause. Whether it's someone that you know, a co-worker, a friend, it could even be you. So we're here this evening to be empowered. Too many of our women are suffering, and unfortunately, there are those who really don't know what is happening to them in their life, in their bodies. There are those who do know, but they've chosen to suffer in silence. Sometimes maybe it's fear, embarrassment. So we're here to let us know this evening that there's nothing to be embarrassed about. We all are growing older, and there are certain things in life that we need to face. Our objective this evening is that each of us leaves here more informed and empowered. Amen?
And the more we talk about these sometimes taboo topics, even if it's not easy to go through the whole process, but the more we talk about it, you're able to manage a little bit better, right? When you're going through something, even if the pain doesn't go away or the issues don't go away, the fact that you're able to talk about it, it makes it a little easier to transition. So that's why we're here.
And just one more point, the ratio of women to men here this evening, it proves where our mindset is, where menopause is concerned. We're really hoping that more of our men show up this evening because menopause does impact them. They don't deal with the whole physical, whatever the issue is, but they are impacted by what their wives are going through, their mother, their sister. So we hope to see our men coming in also. All right, thank you so much. And at this time, we're going to be having a short video. Someone will be telling us of their experience through the menopause journey. And just one more housekeeping. There's a mic that's in the center here. After the presenters have finished with their presentations and you have questions, we're going to ask you to go to the mic and ask your question. This is important for those who are online to be able to hear your questions. Okay? And if your question is of a sensitive nature and you don't feel comfortable to say it, just raise your hand. We'll take a paper to you discreetly, and then we'll read the questions for you. Okay?
And
Thank
Sister
you.
Cheryl, we want to also welcome our online audience because
Yes.
they're here.
How could we
Right,
forget?
so we thank you for joining us, and you can feel free to join us in the discussion in the chat. All right, thank you for joining us.
Thank you.
Jesus' name. In Jesus' name.
My name is Judine Thomas, and I thought going through premenopause symptoms would just be a walk over in the park for me. After speaking to my gynecologist and hearing from other friends and family members, it's just not the same. Just want to share some of my symptoms with you are intense headache and cold chills, abdominal pains, and recently I found out that I'm having dry mouth, so I have to be constantly drinking water and to keep my body hydrated. And guess what? All months are not the same. Some months we have like spotting for 1-2 weeks, and then other months it's just uncontrollable. So in that time, what I use to help me is lots of deep breathing and to stay consistent on taking my daily multivitamins. That will help me to go through an awesome day. So thanks for listening. Take care.
Good evening, everyone. Our first presenter is an experienced obstetrician and gynecologist with over a decade of expertise in maternal fetal medicine. He has performed groundbreaking surgeries on high-risk pregnancies, including 2 of the first successful intrauterine blood transfusions in Jamaica and the Caribbean. Dr. Campbell has authored numerous international publications and serves on various professional boards and committees. Currently, he is a consultant at the Cayman Islands Hospital's Department of Obstetrics and Gynecology. He is passionate about teaching. Dr. Campbell attributes his success to his faith and devotion to God, dedicating his life to serving others through his medical expertise and spiritual guidance. Isn't that a blessing? He is married to the wonderful and beautiful Glenda Lee. Dr. Campbell will be presenting on the physiological changes related to menopause. He will also focus on the emotional and mental perspectives of menopause. Please join me in welcoming Dr. Leroy Campbell.
Thank you very much for that introduction. And Millicent asked me to send a profile. I said, you know me long enough, I'm not sending any profile. So whatever you feel comfortable in saying, then I'll be quite happy to help. Listen, guys, I want you guys to feel very relaxed. I'm very relaxed, okay? I enjoy what I do, and as a consequence of that, I want you to enjoy this experience. If you have questions, feel free. I'm going to try and make the talk fairly simple and understandable, and we'll leave adequate time for questions at the end, okay? First of all, I want to extend thanks to the organizers. I understand this is a collaborative effort between ladies and men and, all the ministries combined, right? So thank you for the invitation. Thank you to Pastor Chambers. I just found out that I had a relative here, a short while ago. So thank you to Pastor Chambers. Thank you, Elder, for this opportunity to speak to the congregation. I'm seeing a lot of familiar faces, but I won't call any names, right? All right, so if I can achieve, there are 5 key objectives that I'd want to achieve, and if we achieve those, then I'd be very happy. First of all, for us to understand what this whole thing of menopause is, what it is, and secondly, why is it important for us to talk about? Why is it that you're going to delay my Sunday dinner to be here? Is it that important for me to give up my food to be here, right? Must be. We want you to understand a little bit about how it affects the body, and in so doing, understand why sometimes, even though it's a natural process, it can feel like a disease. And consequently, because it feels that way, it requires treatment from time to time, okay? And then, of course, we'll leave some time for question and answer. So if I were to ask the question, what is menopause, would anyone be able to answer it? Huh? So somebody was reading my answers. So,
No, based on the introduction from before, yes, give understanding.
just pause of men, that's what it means?
A cessation of the monthly cycle.
Okay, so we have a good student. Put your hands together for Elder at the front. You know, I'm happy to see the men in these kind of conversations, these sessions, because I've heard this saying before, that most of women's problems start with men. I didn't coin that. Menstruation, menopause, you know, mental illness. You know, so I've heard. You know, my wife is here. So my lovely wife is here. Her name is actually Glendie, not Glendalee. But is that true, baby? No. She says no. Okay. So fortunately, it's not true, right? So we understand today that the men in menopause does not mean men, but rather it refers to months, right? The monthly menstrual cycle. Okay, so when we talk about menopause, what we're really referring is a cessation of that monthly cycle. But there are certain criteria that we use from a medical standpoint, okay? So the first thing is that the cycle has to have stopped, but not just where there's a time that's required, okay? So greater than 12 months or greater than a year, okay, for us to classify this as menopause. And also, it's important that we do basic due diligence to ensure that the menses have not stopped because of some other cause, some other disease process that might be taking place. Does that make sense? And that's extremely important because there are a number of things that can cause a woman to be missing her periods, right? Do you know the most common reason for that? Well, somebody said stress. Pregnancy, yes, absolutely. Pregnancy is the most common reason. So you don't want to be calling a woman menopausal and then 9 months later you find out that your diagnosis was wrong, right? All right, so there are a number of other things, but another time we can get into that. So the key thing is to really make sure there's nothing else going on. Now, why is it important for us to talk about menopause? There are a number of reasons. First of all, it's very common. You know it's common? It's common because if you live long enough as a woman, you will go through menopause. So it's important that we understand that menopause is not a disease. It's a natural process of God's grace of life. Anybody wants to live long? Okay, then it means you want to go through menopause, right? It's inherent in the fact that if we are blessed to have at least 10, as the scripture says, then you are going to, as a woman, go through menopause, okay? Now, even though it's something that all women will eventually go through, the evidence shows that not many women are knowledgeable about this. In fact, over 90% of women have never had any formal instruction or teaching about menopause. It just happens. And when it happens now, you start wondering, what in the world is going on with me? Or, if you don't realize something is wrong, the people around you would be wondering, what's going on? There's something changing here, you know? And most of the time, that's when women start to try and get some information. So 60% of women who actually do any research only start researching it after they realize that I don't feel too right, you know? I was in church today, and I was looking around. I said, the AC look like it's not working properly. And I noticed there was a higher percentage of women who were fanning, you know, taking out pieces of paper, whatever they could find, you know. So I was wondering, is it that I should do a survey on the menopause? And sure enough, as soon as the service was over, I was accosted by a member of a member of the congregation, and said to me, "When are you going to be doing a talk on menopause here?" And I said, "What do you mean?" Apparently, the flyer, I saw your picture on a flyer. So I said, "Don't worry, soon enough, soon enough. Or you could come and listen to this one, right?" I'm looking to see if I'm seeing her here, but not seeing her. Yeah, so I figure it's quite appropriate, right? It's quite timely. The other thing is that quality of life is affected. At least half of the women who go through menopause will tell you that it affects either their home life, their work life, or are we eating on over here? I don't see the kids, yes, or their sex life. We said those things in church, right? I don't want pastor to read me out, Okay, good, yeah. So it is going to have, it is likely that almost every woman who goes through menopause will be impacted in one of these ways by the changes. So you can see then, if it is that you're going to go through all of these things, then we might as well talk about it. You agree? Now, when we talk about menopause, age is important. Age is important because it helps us from a medical standpoint to get perspective, okay? So most women will go through menopause between 45 and 55 years of age. That's the range, okay? That's the range. And I'll explain to you soon why there's a range. So the average age in the Caribbean, and in the world for that matter, is 51 years old. So it's either 51.3, 51.2, depending on where you are. But on average, most women, the average age of menopause will be 51. Okay? Now, if you're having menopause starting before 45, then that's considered early onset menopause, early menopause. Okay? If you're having it before 40, then that's actually something we call ovarian failure, all right? Or primary or early ovarian failure. Now, why is this important for us to use these terms and to be aware of this? It's important because there are certain things that happens to the body when you go through menopause. We're going to break these down. So can anyone tell me some of the things that happens to a woman's body when she goes through menopause? Weight gain, all right. Somebody says weight gain. Anything else? Hot flashes, yeah. Lethargy. Anything else? Irritability. Yeah, in the Caribbean we say miserable. Yes. Brain fog, excellent. All right. Loss of appetite. Varies. Some people say the opposite. All right. And then you feel like you want to get your own apartment. That's why it's called an apartment, it's apart from the men. I'm just kidding, guys, please. I'm just kidding. Don't attack me now. I'm just playing around. All right, good. So a lot of things, cardiovascular changes, and we're going to go a little bit into that now. Bone loss. Some of you have heard about osteoporosis, where the bones get weaker. So what? Insomnia, difficulty sleeping, right? So what you find, I don't need to do this talk. I can leave then. You guys got this. People are too bright, man. Oh my goodness, absolutely. So that's the reason why I said to you that we have to make sure it's not due to some other cause. That's why we said that. Now, if you think about these changes, so we're saying every system of the body can be affected. The earlier menopause occurs, the more likely those changes are to have deleterious or negative impacts on a woman's long-term health. Does that make sense? So if a woman is going into menopause at 30 or 35, you can see that she's going to be at high risk, for example, of having osteoporosis or brittle bones later in life. Does that make sense? Or a higher risk for certain issues cardiovascular-wise or You know, so it's very important that if it is that this age factor is taken into account, because it means that our approach might be different from someone who is going into menopause at the normal age. Does that make sense? All right. Very important. All right, so let's understand a little bit about menopause. If we're going to understand, we have to start where? Where do we start, Pastor? In the book of Chronicles or Genesis? In the beginning, God created. In the beginning. He's a wise man. He's a wise man. In the beginning, yeah. So now, so we are going to start, Pastor, in the ovaries, right? You know what the ovaries are? I'm going to leave you alone. Don't worry. I'm going to leave you alone, you know. You should know. His wife is a nurse. That doesn't mean he's a nurse. Come on now. That's not fair. That's not fair. So men have testicles. Women have ovaries. No, not vagina. Ovaries. Right? They have vagina as well, but the comparison is ovaries, right? Now, the ovaries are like the egg factories, right? So the eggs are the original building blocks for reproduction, right? The egg combines with the sperm to give rise to an embryo, which is what eventually develops into a baby. So the ovaries are egg factories. In fact, they're not really factories because the eggs are there from birth. So by the time a baby is formed in the womb, there are millions of eggs in the ovaries. By the time birth comes, you're probably about 1 million. And then these eggs gradually are lost, even from inside the womb, so that by the time you get to puberty, you're looking at probably a few 100,000 eggs. And then those eggs are gradually lost throughout life. Menopause occurs when all those eggs are gone. And the reason for this is because the process of maturation of those eggs is what leads to the hormones that allows many of the functions that make women women. Okay? So every month, the body goes through a cycle. What's the purpose of that cycle? Any takers? Huh? Reproduction? I thought you were going to say for torment. I'm a gynecologist, and I've told you how many times I've heard women say, I wish I was a man, you know. Why do women have to go through these things? I didn't make the rules. But at least I can help, right? To make it a little more tolerable. So, what's the purpose of the cycle? Every month, do you know, women, that your body tries to get you pregnant? Every month. Under normal circumstances, your body tries to get you pregnant. See, I look up this stress on your face. Yes, that's true. So he's like, oh, okay. So it was more like, oh, that was the problem. Yeah, every month your body tries to get you pregnant. So every month what happens is your body starts recruiting eggs to develop. And they're, you know how women are, they compete, the eggs compete to see which one is going to make it, you know. So a number of eggs develop and they're all competing to see which one is going to make it. And eventually one, they have a pageant going on now, right? Miss Campbell or something like that. So one egg eventually makes it each month. And the others who don't make it, you know what happened to them? They die. It's a cruel, cruel world. Eh? Yeah, the other eggs die. That's the reason why you're losing eggs all the time. So, that one egg that develops eventually is released. That's called ovulation. When the egg is released. And that now allows it to meet with the sperm, right? Now, while you're going through that process, guess what's happening? The is surrounded by cells which are producing hormones. Estrogen being one of the key hormones. Anybody ever heard of estrogen before? Show of hands. Who have heard of estrogen? Right, so estrogen being one of those key hormones. And what estrogen is actually doing, it's causing the lining of the womb to grow in preparation for pregnancy. So that if you get pregnant, there's a nice cushy place for the egg to land and to develop. That's what estrogen does. And then after you ovulate, it starts producing another hormone called progesterone. Don't worry about the big fancy name, but these are hormones. That's all you have to remember. And the progesterone keeps the lining in place, Pastor, so that the egg has somewhere to stay and develop. Now, if you don't get pregnant, about 14 days after you ovulate, then the portion of the egg that's producing the progesterone dies, and the lining of the womb sheds, and say, "Nothing ever happened this month," and start all over again. Very persistent, isn't it? Trying to get you pregnant, okay? That's a cycle. So the shedding of the lining of the womb is what you see as a period, right? That's what comes out as a period. All this is important. Because what happens when you get to menopause is that now the eggs run out, right? And so because there are no more eggs, that process stops. And that's the reason why you no longer see a period. Does that make sense? Right. So that's the reason why the menstruation now pauses, but it's really not pausing, it ceases. Now, if that was the only problem, most women will say, "Hooray! Hooray! I'm happy. No more pain. No more bleeding." You see, I find women to be fantastic beings, you know. Because can you imagine every month you're bleeding and you still go to work and you still do all of these things, and, you know, we underestimate what is required to be a woman. Okay? We do. Put your hands together for yourselves. Absolutely. You know? So, most women would be happy. They don't have to say any period anymore. They don't have to plan when they're going on a trip. They don't have to be packing up this bag with this and that, and they can just freely, like men just walk out and don't worry. You know? You know, we have so many things going on for us, you know. When I shouldn't say this, but when I was, you know, we're among friends here, right? So like, you know, there are certain things I would not accept from my male residents when I was back home or when I was teaching. I wouldn't accept them being late. You know? I would accept anybody, I don't want anybody to be late, but especially the men. Because I said, if the woman can get here early, all you have to, let me not say, you know, if you're like me, you know, you don't have to watch no here, you know. You put on your clothes and you come. You know, the woman have to get up, she have to, and I talk about, even if she don't have kids and all these other things, she have to get her hair fixed up, she have to make her face made up, she have to figure out which clothes she's going to wear. You know, it's a lot different to achieve the same objectives. All right? And I'm no feminist, I'm a realist, okay? So most women would be happy if that was the only issue. The problem is the hormones. Somebody said the hormones. That's the problem. Because the reason the period is gone is because the hormones are gone. You see? The estrogen is gone. Progesterone is reduced. And the problem is that those hormones didn't just serve a function. I don't want the men get tight on me now, throw me big up the woman. Come on, humble yourself, relax. Let's give credit where credit is due, right? Solid? We're solid? We're solid? We're solid. Okay, good. I see my name's start get tight, you know. Let's chill, man. Let's chill. The hormones. So these hormones don't just impact the reproductive system, they have influence everywhere in the body. They have influence on the brain. They have influence on the cardiovascular system, the heart and the blood vessels. They have influence on your gut and your digestive system. They have influence on your bones and your muscles. Remember we said all of that? So literally, when these hormones go, it is almost like you had somebody who was on drugs for a long, I mean, in the nicest way possible, who was on drugs for a long time, and you just stop it. You know anybody who, like, for example, who drink alcohol and or used to smoke, or you don't have to say amen, don't have to put up the hands or anything. I mean, Pastor, one of the challenges why it's so hard to get people into church sometimes is because of substance. Because when you have been on something for a long time, and the church say, boy, you have to stop drinking, you know. And you have to stop smoke. And you realize, boy, when you stop, you start feel bad. It's difficult. We call it withdrawal. These are withdrawal symptoms that people have. If you can understand the concept of withdrawal in the context of substance, then you can understand what happens with menopause. Because you have lived for 51 years with these hormones. And as much as they did some stuff to you that you didn't like, you're used to them. Alert, my brain is adapted to them. And then all of a sudden now, they withdraw the hormones. So you can understand why the body feels sometimes like it's going crazy. Does that make sense? So when we talk about the brain, estrogen has very important functions on the nervous system in terms of regulating nerve function, brain function. You understand? And we know this because a woman goes through swings. That's so? Mood swings. You see, that's the only good thing about being a woman is you can blame it on the hormones. Man don't have no excuse to get upset, you know. Because if you get upset, they say, you're going like a woman. Am I right? They say that here in Cayman. In Jamaica, that's what they say. Because of the hormones, right? So, if it is now that you're removing estrogen, then you begin to see that some women develop symptoms. Their moods are not as easily regulated as was before because there's no consistency to it. Some women experience depression, anxiety. Some women, I know everybody, what's the most common symptom? No, that's not the most common one. It might be common, but they can't remember that they had it, so that's probably why. Hot flashes, yeah, temperature regulation. Because one of the things that estrogen does, it regulates the temperature regulation in your brain, the thermoregulatory centers we call it. So now when you remove estrogen, now you're not sure regulating the temperature. So 1 minute you're in here feeling cool, the next minute you're hot. Right? I mean, I'm talking and people just start funning. It's like, he said, Doc, I don't know because I'm in the office and I have on my turtleneck and my sweater and my jacket, and the next minute I'm taking it off and I'm at the house and I'm covering up in the blanket, and next minute I throw off the blanket. And my husband said, what's wrong with you? Just tell him I'm having withdrawal symptoms. Now, so it's not just the brain, right? And that's why somebody said memory loss, yeah? Some women experience fogginess, can't concentrate as well, you know. So yeah, I get upset easy. I remember when it's years after I got my training that I started to become more empathetic towards my mother. I was like, now I understand what was going on in your life at that time. It's great. Sorry. You telling her? I've said it before. I remember saying it on a radio show back in Jamaica. I remember saying it on the radio, and somebody called me, "Oh, you said about it," but it's true. It's reality. I won't tell you what my nickname was for her. Should I tell him? No. That's too personal now. After service, you can do it. Yeah. So it affects the brain, the nervous system. It affects the muscular system. Because one of the things that estrogen does, it actually builds up the tissues. And so when estrogen levels fall, you have a greater difficulty in retaining muscle mass. The ligaments get more lax, which increases the risk of injuries. The bones begin to lose density, increasing the risk of fractures later on. Then we talk about the reproductive system, genitourinary system. The vaginal tissues get thinner. And so some women experience painful intercourse. Some women experience bleeding for no reason. They don't, the vaginal dryness. So then when you add all of that, the emotional, psychological impact, plus the physical, then you lose libido or desire for intercourse and intimacy. You know, so that may be a part of it. For some women, it actually increases their libido, but most times it's really the opposite. So you see now it's affecting throughout the body, right? So let's talk a little bit in the time remaining about treatment. Now, I want to say again to you, remember that menopause is not a disease. It's not an illness. Even though you can feel ill, it's not a disease. But I would submit to you that even though it's not a disease, every woman who is experiencing menopause needs treatment. Somebody say yes, somebody else say, what do you mean treatment? I need treatment. Needs treatment, and it's important for us to understand what we mean when we say treatment. Treatment doesn't mean drugs. And I need to recondition this thought process because we think, based on our westernized approach to medicine, that automatically when a doctor said treatment, it means drugs. In fact, there are doctors who think that. So, there is a term I've coined. I thought I coined it until I went to the conference yesterday and I heard one of the presenters talking about 5 fingers. But it's a term I coined, the 5 fingers of health. Okay? Now, the 5 fingers of health are simply what I have distilled down good health-seeking behavior to be. The first is rest. It's very important that we have adequate rest, especially as we get older, especially as we go through things like menopause. Not we, but as women go through things like menopause. The men have a similar thing, but it's not menopause. Rest together, yeah. Rest is important. And a lot of the times people talk about rest, they say, but doctor, I can't sleep. I'm not talking just about sleep. I'm talking about rest. And one of the things I like about my SDA friends is that they make sure they talk about rest. it is critical that there is a time when we put some things aside to allow our mind, our bodies to recover, especially when the hormone levels are falling and your tissues are not what they used to be. Because if we don't, then we're going to break down faster. Does that make sense? And it's very important that we grasp these things, you see, because what I'm telling you here is what reduces the need for medications and interventions and all these things, okay? So the second finger is nutrition, right? Nutrition. Nutrition really speaks to what we eat, right? What we drink, what we put into our bodies. It is a recognition that our bodies essentially are made up of what we consume. And so the quality of what we consume will ultimately determine the quality of our bodies and in turn the quality of life we experience. Does that make sense? So nutrition is key. There are many things that we get in medications that we can get from the food. And it's funny, even nowadays they talk about bioidentical hormones and extracting it from the yams and extracting it from the soy and extracting it from all over. But it's in the food. Okay? And obviously there's a nutritionist who's going to be talking, so I'm not going to spend a lot of time on that. But one of the key things I want for you to understand when we talk about nutrition is that let's keep it real, folks. Anybody asks what Dr. Campbell said about nutrition, that's what I want to tell him. Let's keep it real. What do I mean? What I mean? Real food. Because you must understand a lot of what we eat is not real food. Processed stuff. There are kids nowadays who have not had real food since they were born. Everything has been gone through a processing. If you put it on the corner, anything that's going to last 10 days without you having to refrigerate it or cook it, something is wrong. Another time we'll talk about that. It's not real. Exercise. Very important. And what I'll say about exercise is simply you telling your body what you want it to do. So somebody sitting down, if you're sitting down watching TV every day, guess what your body is going to say? Oh, this is what you want me to do? And it's going to adapt to sitting down watching TV every day. So one day, when you're going to see a rat and you run off, by the time you run from the rat, you realize you pull a muscle, and the rat is looking at you like, you drop, it says, a frog, you run from a frog. Because your body has adapted to not running, not doing anything. So exercise is key. Mental hygiene. Just like how we clean out our closet, and we clean the house, we need to cleanse our mind. Have a time when we meditate. Scripture tells us, think on these things, right? And then finally now, medication. And medication comes into play when, if everything else fails and you need help, then the medication is help. This is critical because many of us, our view is opposite. We just say, oh, I have medication. But one finger alone can't fight, right? Come on, man. You ever see Mike Tyson knock out anybody with his pinky finger? No. No matter how bad you are, you're not that bad. But if you have 5 fingers, you can deliver a decent blow, right? So I'll wrap up with the medication aspect of it. And we'll generally summarize these into 2 groups, hormonal and non-hormonal treatments. The first statement I would make regarding medication is that the single most effective treatment for menopause-related symptoms and disorders is hormone replacement therapy. Because the problem is a deficiency in hormones. So the single most effective treatment is going to be replacing the hormones, right? Now, I must add to that the fact that the decision regarding hormone therapy is not a simple one. And this is why you need people like me. You need to talk to a appropriately trained physician to guide you through that process. Simply because there are some factors that will make it dangerous for women to be on hormone replacement therapy. And there are some things that could be treated with other therapies apart from hormone replacement therapy. So you need someone to guide and coach you through that process. And that's important. I'm saying this because there are a lot of products being marketed now as supplements which are actually hormone replacement therapies. And they are not regulated. And so women may end up taking these things to their detriment. Okay? Non-hormonal therapies are generally a group of therapies that are focused on dealing with one aspect of the hormonal, of the menopausal syndrome. So for example, women who have hot flashes, and that's the only problem they have, sometimes can be treated with medications that deal specifically with that. Women who have vaginal dryness can be treated, for example, with medication, and these are non-hormonal, right? And then we have supplements. And generally, there are many natural herbs and so forth that have been used in treating menopausal symptoms. The issue is none of the studies have shown any particular one to be particularly beneficial. So you thought even Primrose was it, right? But the high quality studies doesn't show. However, my functional medicine friends will tell you that perhaps it's because you're using them in isolation. Sometimes combining the different, having a proper combination may help. And there are preparations like that. I have 1 minute remaining on my talk. And I'd like to thank you for your attention and open the floor for any questions. All right? Don't make it too hard, no, you know. Not an exam. This is Sunday. I'm supposed to be easy like Sunday morning, right? Sunday evening.
Hello, yes. So I want to know if hormone replacement therapy is available at HSA. Is it covered by insurance? HSA employee here.
Okay. Well, fortunately for you.
And also, you know, I've been reading about bioidentical hormones versus none. If you could shed some light on that.
Yes, thank you. So let me repeat the question just in case, you know, it was missed. So there are two questions actually. The first is to know whether or not hormone replacement therapy, which I'm going to refer to as HRT from now on for short, is available through the HSA. And then the second is a comment on bioidentical hormones. So to answer the first question, a simple answer is yes, HRT is available, and there are varying forms, and most of the very popular forms are available, preparations are available through the HSA, and are covered by insurance. So that's good news. Regarding the bioidenticals, this was what I was kind of alluding to when I was saying before about preparations on the market. So bioidentical hormones are really a group of drugs, and I will call them drugs even though many times they're marketed as supplements, that are essentially hormones that are supposedly developed in a more natural way that are identical to the hormones in the body. All right? Most times these are obtained from plants. Okay, it's like soy, yams, and potatoes, and different plants. And but even though in theory it sounds good, what has happened in the marketplace is that essentially by the time these supposed bioidenticals are processed to make them abundant enough for sale and to be packaged, they're actually quite synthesized anyway. So it's not much different from what you will have in regular HRT. Okay? However, they are very robustly marketed, And I think every now and then, especially with topics like menopause, we go through phases where there's something that becomes very popular and eventually it dies down. I suspect that might happen. The key thing here is that if you're going to be taking anything hormonal, discuss it with your physician first. Okay? One of the other issues with a lot of the bioidentical preparations is that many times these compounds have combinations of hormones within them. And so therefore you may find that you may be taking a particular hormone that you really don't need that may be increasing your risk of certain issues. Okay? So it's very key that if you're going to be taking any hormonal preparations, whether bioidentical or not, it's very important that that discussion is had with your gynecologist, or at least your family physician. Question.
Good afternoon, everyone, and thank you again. I came in late, but I enjoyed the discussion.
Can
you speak about menopause when it's because of surgical reasons? So I would have had surgery a couple years ago, so I'm in menopause effectively. And I've been to physicians, and I've said to them, I am crazy now. I am hot, and I'm crazy. And they're like, you're too young. And I'm like, no, I'm not, etc. So I want to discuss what's the criteria that you would take into consideration for the hormonal HRT? And basically, how can physicians, I guess, be more, I guess, attentive to the fact that when people come before them and say, look, this is what's happening, I need help, I don't really get a lot of support sometimes from the medical profession.
Very, very, very good question, and a very honest question. I appreciate your honesty. Okay, so for those who perhaps didn't hear the question, what are the implications for surgically induced menopause? So menopause that's related to surgery. And there are three types of patients in this regard. The first, most of the time we're talking about a patient who may have had, for example, a hysterectomy, okay? And it's important for us to understand that the womb and the ovaries are different organs. So not because a woman has a hysterectomy means that she is in, quote unquote, in natural menopause. And I'll explain why. Removing the uterus will cause you to stop seeing periods. And so, by definition that I gave, after 12 months of not seeing periods, you'll be considered to be menopausal, by that definition that I gave. But most times nowadays, if we're doing a hysterectomy for a young woman, the ovaries are left behind. And so it's possible to be menopausal surgically in terms of not seeing a period, but not be menopausal naturally, because the ovaries are still there and functioning. Does that make sense? And so if you have a woman who fits into that category, generally speaking, there is no need for intervention. She generally will feel fine, okay? I'm just giving generally, right? So that category, not because she is no longer seeing a period, means that she's in natural menopause. Very important. The second category is the woman who has the ovaries removed. All right? So sometimes you may do surgery and the ovaries are removed at the time of surgery. Or a woman may have undergone therapies that have been destructive to her ovaries. So for example, cancer as a child, got chemotherapy or something, and it has damaged the ovaries, okay? And so the ovaries have failed. In that case, especially if this, remember we spoke about the age? If she's a young woman, it is imperative that the option of HRT be discussed. So it's not even something about, from a medical standpoint, it's imperative that at least that discussion be had. Because as you remember in our talk, the earlier menopause occurs, the higher the risk of complications, like the cardiovascular disease, like the bone disease, like, you understand? So it's imperative if you have a woman who is young, less than 40, less than 45, that that discussion be had. In fact, even before the surgery is performed, if the ovaries are going to be taken for a young woman, that discussion should be had. Does that make sense? So the third category is a patient who may have had a hysterectomy. The ovaries were retained, they weren't taken, but because we have disrupted the blood flow, the circulation in that area, they go into menopause earlier than they would have otherwise. You see? And in those cases, it's imperative, once again, that that discussion be had about HRT. All right? So if they don't want to talk to you, then I'm sure we can talk to you about that. Don't worry. We got you covered, okay?
Just want to say thank you so much for being here. We really appreciate this. I have two questions. The first one, what happened if someone would have been, like, thought they were in menopausal stage because they stopped for that 1 year, maybe 12, 13, 14 months, and oops, comes Sister Red. And my second question leads to, this may be something that is ongoing or start, however, I can specifically state the date I would have lost elasticity. Is it that my menopausal start that date, and can that be reversed, the elasticity, especially in certain parts of the body?
Yeah, those fantastic questions, fantastic questions. All right, so let's deal with them one at a time. The first question had to do with the return of Sister Red. You called Sister Red, okay. Is she a member of this church, or? She comes sometimes, okay. All right, so Sister Red now. If it is that a woman has gone through and fit the criteria of what we said is menopause, meaning a year has passed, hasn't seen a period, and her period returns, that is what we call postmenopausal bleeding. And postmenopausal bleeding should always, notice I say always, always be assessed. Hence the pause to make it so settle. Very important. Why is it important? It's important because in about 10% of cases, it may be as a result of something serious that could even be cancerous or could lead to cancer in the future. You see? Doesn't mean that if you have postmenopausal bleeding, you have cancer, so don't go jumping off a building or getting depressed. Because 90% of the time it's not. But because of that fact, it is imperative that it is assessed so that we can at least rule that out. Okay? So that, I'm very happy for that question. Thank you so much. You may save a life because of the question you asked. The second question you asked is related to a loss of elasticity in the ear. Oh. She's so clever. She said the body. So particularly, it is true that elasticity is lost all the way through the body after menopause. Because one of the things that estrogen does is to stimulate the production of collagen, which is a key ingredient in our skin and soft tissues, that keeps it nice and sturdy and strong, right? So you find, that's the reason why, for example, after menopause, you find wrinkles becoming more prominent and so forth, the skin becomes thinner. Now, we tend to talk more about it when it occurs in the genital area, because sex is important, isn't it? And I'm in church, and nobody's going to say amen to that. But you see, the good thing, if we're among the men by themselves, I'll get a total different response. But one thing I've learned is that what happens in men's fellowship stays in men's fellowship, right? Yeah, so that same loss of elasticity is occurring in the vagina as well, the genital area. Also, what happens sometimes is that, especially for women who have gone through childbirth, the muscles that support the pelvic floor, that on which the womb and the bladder and everything rests, and that also help with the quote-unquote tightness of the vagina, those muscles and the nerves that supply them can be damaged. Now, when you have high estrogen levels, the ligaments that support these organs are strong. And so everything may still appear fine. But when the estrogen levels fall, the ligaments now become thinned all over. And so what ends up happening is that there's a loss of vaginal tone. That's a medical term for what lay persons will say vaginal tightness. There's loss of vaginal tone. There is also sometimes prolapse, where the organs can begin to push down. So some women may experience a bulge coming from the vagina and so forth. Some women may experience issues with urination, where they're leaking, what we call incontinence. And all of that is because of the effect of the reduced estrogen. Can it be fixed? Yes, of course. Depending on the severity, sometimes we may be able to just use localized hormone therapy, for example, with estrogen cream in the area. So that allows you to have the benefit of the estrogen in that area without much of the systemic effects. And in some cases, we may use physiotherapy to strengthen the muscles to compensate for the weaker ligaments. And if in certain cases where it's severe, then we operate and we can fix things up. Okay. Am I out of time for questions?
Yeah, we'll take probably, yes, just those that are there, and that's it.
I see you got to look a while ago. Don't play with me.
Good
Intimidating look.
I have two questions and a very ambitious request. My first question is there a difference between early menopause and perimenopause? And my other question is, why is it perimenopause is not widely discussed, even though its onset begins at about 40 years old? And my ambitious request is that this is really a very good session. I'm impressing upon the planners to have one for the men in regards to sex and mood changes.
Okay, all right. That would be interesting. Yeah, that would be good. I'm sure we'll see more men for that one. Okay, all right. So let's deal with the questions one at a time. The first one was perimenopause. Yeah, very good question. So the first thing is that we understand that it doesn't just happen like that. It's a transition. In fact, when we talk about menopause, in the current medical nomenclature, we talk about the early transition, late transition of menopause. So the process starts long before we diagnose it. Before the period stops, the process starts, and we refer to that as perimenopause. And sometimes the same symptoms that you'll have in menopause, you may experience long before, as much as 10 years before you're actually going to menopause. Right? So a lot of symptoms that we're describing don't just happen after the period stops, but can start before. Very important point to make. And quite often it brings much frustration to women and their physicians too, because they say, why am I feeling this way? And you're still seeing periods. If you don't understand that the symptoms can start before. Okay? But what's key though is that if it is that you're experiencing these symptoms before, then it's even more imperative to rule out other causes. You understand? Because it's easier to assume it's menopause if the periods have stopped, but if the periods are going, then it's very important to rule other causes out. Did I answer both questions, right? Well, I think overall menopause is not widely discussed. It's now becoming a thing for discussion, but for many years it wasn't. Okay? And I think perimenopause will eventually follow as well, that people will become more aware and there'll be more discussion. I think it will become a natural evolution of the discussion. And then for the men, that's for me, that's for somebody else, okay. Happy to help if needs be.
All right, thank you so much, Dr. Campbell. I appreciate your presentation. I think I actually had my question before you started your presentation.
Okay.
I had a checklist, and while you were presenting, I was going through and saying yes, 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 yes.
Okay.
It goes to the question that is asked. At a very young age, 38, I had a hysterectomy, and I had one overlift. I've been going to the doctor and I'm telling them something is wrong with me. It's not all in my mind. They do a lab and say, oh, you're not going through menopause. It's just something, you're overworked, you're burned out. But I know in my head and how I'm feeling, it has to be early menopause. So my question is, when is it that physicians differentiate, not just looking at the lab test, but looking at the symptoms that the person telling you and try to deal with it then?
Yeah, that's a good question. I mean, she said, when we did, like yesterday, did it 38 years yesterday?
Oh, yeah.
Okay. That kind of case is the exact setup for early menopause because, as I mentioned, one is only one ovary left. Yeah. And then two, as I mentioned before, sometimes just the disruption of the blood supply in that area can lead to that ovary failing sooner. As it relates to the physician's approach, I think I will admit that sometimes we get too caught up in the process and not the patient. Sometimes we get caught up in the tests, the results, and not what the patient is experiencing. And it's certainly important for us to talk about what you're experiencing. Right. Now, I will explain, though, the challenge that sometimes physicians face. The challenge is that, do I offer hormone replacement to this patient if the panel is saying her hormones are normal? You see? Because remember that for everything that has a benefit, there are potential risks. And whenever we prescribe medications as physicians, what it really is a balance between risk versus benefit. That's what it is. If I give you Panadol, there's a risk. So it's a balance between risk versus benefit. And so now, it is now incumbent on us to say, okay, is it worth the risk? The truth is, most of the time, for a otherwise healthy young woman, the risk is quite low. You see? And so there may be the benefit of that. Also, there are non-hormonal therapies that sometimes may help. You get what I'm saying to you? So you're absolutely right in terms of being careful of not just reading the panel, but reading the patient. Understanding that while the levels might be within the normal range, you have a range for yourself. And it may be in a normal range for the population, but perhaps your estrogen levels are normally higher than that. And so what I'm seeing now is low for you, hence why you're having symptoms. So all of that has to be put into place. But at least we can see the empathy on both sides, why it's sometimes a challenge.
Second question. I know in the past they were saying about estrogen hormone being, especially person with family history of breast cancer, should be kind of contemplated. Is that still what the research is saying?
Yeah, so the good question. The truth is, more than estrogen, most of the risk is related probably to progesterone based on the studies that we have available to us. Now, the risk overall is quite low. However, in women who have a strong family history or a personal history of some hormonal dependent cancer, it's perhaps best. In fact, it's probably contraindicated for that woman to have hormone replacement therapy. Also, in recognition of the effect of progesterone, we tend to not use progesterone for women who have already had a hysterectomy, for example, because the progesterone is really to protect the lining of the womb. So we give less hormones to a woman who has had a hysterectomy. We'll only give estrogen because of the lower risk. Yeah.
All right, I'll make these questions quick. These came from the...
Hopefully the answers are quick.
Please, I'm asking them short. All right. So I'm 51 years old. I began experiencing perimenopausal symptoms 6 months ago, and absence of the period 6 months, but it returned. I have memory fog, irregular heartbeat. Visited the cardiology clinic. The tests are normal. They're asking what do they do from here.
So the periods have been absent for 6 months.
And they returned.
And returned, but they're having symptoms that may be that are difficult to tolerate. So the good thing here is that this person has been investigated, I'm assuming, for other potential causes of those symptoms. That's the key. Because saying that this is due to menopause is what we call a diagnosis of exclusion in this case, meaning that we have to rule out other causes. And then if that is the case, then there may be a role for therapy to be initiated, hormonal therapy, or if non-hormonal therapy can manage the symptoms, fine. But certainly that's someone who needs treatment.
Right. Thank you. Last question. This person is 46 years old. They're told that their ovaries are still active, and they had an ultrasound done, a vaginal ultrasound done. They're still on birth control, and they want to know when they should stop. When will I know when to stop?
Mm-hmm.
The person is on a low-dose pill.
That's also a very good question. So essentially the question is, if a woman is on a pill, how does she know when she gets into menopause? And she doesn't need to take the medications anymore. Because if you're on the pill, you may be having a cycle, but it may not be natural. It may just be because of the pills. So generally speaking, a good idea is about 51 years old, or at the stage where she thinks she's no longer at risk of pregnancy. Okay? Does that make sense? Yeah. All right. Thank you very much.
Thank you. The privilege is mine to say thank you, big thank you, many thanks to Dr. Leroy Campbell for this presentation this afternoon. I think we all learned a lot, and I think we have to bring you back. Yes. So please come forward and with the beautiful Glendy. So on behalf of the family ministries and collaboration with other ministries, we present this token to you. So they're both doctors, Dr. Campbell and Campbell. Thank you. Yes, thank you for coming. Okay, all right. I'm apologizing on their behalf. They left church, came here, so I think it's time for them to replenish. Thank you.
So once again, we thank you, Dr. Campbell, for coming. And I wish you were around when I was doing biology, because this would have made so much sense a long time ago. It's coming together now. All right, so we say thank you. And we want to recognize the 20+ devices online watching. Thank you for tuning in. So our next presenter is Mrs. Simone Sheehan. Right, she's a registered dietitian. She has worked with HSA for the past 27 years. She's married, she's a mother. And today she will be presenting on managing menopause through nutrition. Please join me welcome her. Just before she does, we'll listen to a video.
Hi, good evening. My name is Charmaine Thompson-Taylor, and I am a contestant in the menopause arena. Yes. When we were growing older, it was said that we'll grow old gracefully. But then menopause came and it knocked very hard. It knocked and it brought about things like hot flashes, terrible. You'll be cold, you'll be hot, you'll be hot, you'll be cold. And there's no air conditioner, there is no fan, ceiling fan, bedside fan, nothing helps. And then it gives sleepless nights. You'll be under the cover, throwing the cover, pulling the cover, throwing the cover, pulling the cover. That's all night. So you get sleepless nights. And then you get so impatient, irritable. You can go from 1 to 100 in a split second. That's what menopause brings about. And it's not, I thought my situation was bad until I spoke to my friend
Good afternoon. Nice to see you all. Thank you very much for inviting me along this evening to speak to you about the important topic of nutrition and menopause and how to potentially manage some of the symptoms. Is the presentation going to be up there? Okay. Oh, yes, please. Thank you. Now, Dr. Campbell is a tough act to follow. I know. I was gripped the whole time because I'm in that exact same age bracket that we're talking about. So I totally get everything that we're being discussed this afternoon. So the presentation this afternoon is going to, thank you, next slide please. We're going to touch on the following topics. Do you want me to use this? To move forward the slides myself? Okay, thank you. Okay, perfect, it works. Love technology when it works. So I know Dr. Campbell has gone in great detail with these topics with you, so we'll just touch on some of them. But what is menopause? What is perimenopause? Why is nutrition important when you're experiencing this stage of your life? A balanced, healthy diet, particular focus on a heart-healthy diet. Why is that important? Can you hear me okay? Okay. Some of the trigger foods that sometimes may exacerbate the symptoms. Soy, whether soy is a benefit or not. Bone health, because as we know, osteoporosis can be something that can be significant after menopause. Physical activity, why is that important? Sleep is a big one because it often impacts on us when we're going through menopause, having poor sleeping habits. There'll be a little summary at the end, just highlighting the key points, and then the opportunity for questions. Thank you. Let me see, I could just look at this, I guess. Okay, I hope I can read that from here. So menopause is something that all women will experience at different stages. Some people start it earlier, some people are a little bit later, but as we know, it's the cessation of the menstrual cycle, and that results in a corresponding drop in our hormone levels. The average age of onset is somewhere between 51 and 52, but as Dr. Campbell pointed out, there are many scenarios surrounding those age ranges. But generally, if you're going through menopause in a more natural, that hasn't been triggered by surgery or some other reason, it's the gradual reduction of the activity of the ovaries with the cessation of ovulation. There are different stages, as we know. There's perimenopause, and that can start as early as your mid-30s. There's menopause, and then there's the post-menopause stage. So, as Dr. Campbell pointed out, once you don't have a period for 12 months, that is officially the beginning of what would we describe as menopause. In the perimenopause phase, there are a couple of key things that happen. Sorry, did I change that slide? Apologies. I forgot how to do that. And it can last anything from 4 to 8 years. And the symptoms can vary from person to person. Some people happily skip through menopause and barely notice it. Not many, but some lucky people do. And then there are some that get varying degrees of the symptoms, whether it's mild, moderate, or more severe in some cases. We know the symptoms can include mood changes, low libido, hot flashes, night sweats, sleep problems, and a big one for us is weight gain, and is one that troubles a lot of us, weight gain during or after menopause. As we know, osteoporosis, potential heart problems, weight gain, and even memory loss can be features of the menopausal issue. So what can we do in terms of diet, nutrition, and lifestyle to counteract some of these concerns that we have? Eating a healthy, balanced diet across the board is always important, no matter what stage of life that you're at. But there are some key things that we can do to impact the symptoms of menopause as well. Supporting your heart health, because unfortunately, once we've been through menopause, our risk for cardiac events goes up quite significantly, which is also not very good news. Trigger foods, they may vary from person to person. A lot of times people might say if I eat spicy foods, I get more hot flashes, Another person might say, well, they don't bother me that much, but something else might bother them instead. So that would then be a trigger food for them. Soy and soy products, generally are considered to have a benefit, and we'll talk about those. Sources of calcium and vitamin D for bone health. These will also be what we will discuss. And the importance of being physically active and how that can be a benefit. So what are the key components of a healthy, balanced diet? I know all of you in this church right now are very aware of what these key healthy aspects of a balanced diet are. Many of you may be vegetarian as well, which often translates to, a high intake of plant-based foods, which, as we know, have a benefit. So plenty fruits and vegetables, and looking for a variety of colors. Think of the rainbow when you're planning your meals. All the colors that you can think of, orange, red, green. Try your best to make sure that any meal you're planning has as much color on the plate as you can muster. And we will look at the plate in a minute, and we can see all the nice colors that will be on it. Fiber-rich foods are very important for a whole host of reasons. And our goal would be somewhere between 25 to 30 grams per day. So if you're eating a lot of whole grains and you're eating fruits and vegetables and you're including foods like legumes and porridges even in your diet, there's a good chance you're getting close to those numbers. Calcium fortified foods are important, and this also includes, if you're having a plant-based alternative, to always ensure you select one that is fortified with calcium and hopefully vitamin D as well. Lean protein, beans, lentils, split peas, all the legumes, lean protein play an important role, because during menopause, there's this unfortunate thing where there's an increase in our percentage body fat, and unfortunately that also can lead to a reduction in lean muscle mass as well. So having a good protein intake is very important to minimize those effects. And don't be afraid of the healthy fats. Sometimes, there's an idea that any kind of fat is bad for us. There are very healthy fats out there, and they actually can have a benefit. Obviously, we don't want to overeat them, but the average person needs somewhere between 60 and 70 grams of healthy fats each day. So these are important things to include in your diet as part of a balance. So what are the components of a healthy diet? As we mentioned, fruits, veg, high fiber options, and omega-3s. Omega-3s have many benefits for us. They can help reduce the side effects of the hot flashes, but they also help reduce inflammation in the body. So sources of omega-3s would be any of your oily fish, so your mackerel, your sardines, your salmon, your tuna, but also, your chia seeds and your hemp seeds and your flax seeds and your flax meal. These also would be, as well, along with the nuts, would contain natural sources of omega-3s. Foods that are high in saturated fats would be a concern because of the cardiovascular risk after you've been through menopause. Now, if you're vegetarian or vegan, you're probably not eating very many of these saturated fats. But if you're eating a non-vegan, non-vegetarian diet, there is more chance of these saturated fats being in your diet. It may not be coming from meat, but it may be coming from butter or cheese or some of these other foods if you're eating those. Trans fats are a concern as well. They unfortunately make your bad cholesterol go up and your good cholesterol to go down, so they're really a problem. Now, trans fats will come from any kind of baked goods, chips, crisps, things like that. This is where you'll find the trans fats. So it is important to be looking out for those when you're looking at labels. Eating regularly is important because we want to try and regulate our blood sugar levels. When we have swings in the sugars going up and going down, then that can aggravate the symptoms of even menopause. So blood sugar stability is important. You don't have to be a diabetic, but you could still experience some of these swings in your sugars. So it's important, no matter how busy you are, to try not to skip meals, to include breakfast each day, and try and regulate your eating pattern. And the next slide is going to have the plate model example, which when you see it, it'll start to make more sense. The whole grain fiber-containing starches are good to include as part of a meal. Often people think, oh, I mustn't eat any kind of starch. I avoid rice, I avoid all these things because that is the best way to eat healthily. But that's actually not strictly true, because they provide a lot of key nutrients, and in particular fiber, as long as we're choosing the whole grain versions. So when we say whole grain, we mean if it's rice, brown rice. If it's bread, brown wholemeal bread. If it's pasta, whole wheat pasta. Crackers, whole wheat crackers, etc. So we're looking for the whole form of these foods wherever possible. So this is an example of what a healthy, balanced meal, the components that would be on the plate. So as you look at that slide, you see 50% of the plate. Nice colors, isn't it? You see all that lovely, would you eat that? I would totally eat that, it looks delicious. So you have all the, the red apples, the green peas, you have the spinach, you have some mango in there, you could have some sweet potato, you have strawberries, blueberries, broccoli, Brussels sprouts, red cabbage, all really tasty looking ingredients. And then you see 25% is your lean protein. So you have your peas, you have your beans, you have your chickpeas, your lentils, you have your tofu, your soy, your fish, all those good sources of protein in there. If you're having dairy or non-dairy plant-based alternatives, then obviously that's important to choose ones that are fortified as much as possible with the key nutrients like calcium and vitamin D. And then you see your whole grains, you see your brown rice, you see your quinoa, you see your whole wheat spaghetti, whole wheat toast. So those are foods that we know, if they're included on a regular basis, not only are they part of a healthy, balanced diet, but there's a lot of benefit in terms of menopause symptoms by choosing these healthy foods. Some of the culprits for some of the triggers for menopausal symptoms might be caffeine, alcohol, and spicy foods. With the caffeine, the symptoms can vary from person to person, but some people who are getting hot flashes, if they drink hot tea and hot coffee, it can worsen the situation. It's important to remember that caffeine doesn't just come from tea and coffee. You'll also get caffeine in chocolate, unfortunately, and also sodas and those types of drinks. When you look at the ingredients, you might be quite shocked to find just how much caffeine is in there. Alcohol, as we know, can be a trigger as well of the symptoms. So if you're having symptoms, it's really advisable to avoid alcohol if you can, and the spicy foods we spoke about. And that can vary very much from person to person. With the soy, many years ago there was some concerns that having extra soy-based products might increase the risk of breast cancer postmenopausally. But that research hasn't really been, it's outdated, let's say it like that. So including some soy-based products, at least 2 servings a day, has been shown to help lower obesity by as much as 40% in postmenopausal women. So including your tofu, your edamame, your soy-based options, these can be beneficial for sure to help with the hot flashes and even the weight gain. So definitely worth considering. Of course, how you cook the likes of your tofu, if you're going to fry it up in something, then it's still going to add some fat. So other ways to cook tofu might be to bake it or air fry it, cut it in cubes, and season it the way you like to season it, and it still can be very flavorful, and you're still getting the health benefits without necessarily putting it in the frying pan. The osteoporosis is definitely a concern. So the bones can become weak, and so physical activity, which I know Ms. Raquel is going to speak to you about this afternoon, is significant in bone strength and in keeping your bones healthy, but so is an intake of calcium and vitamin D. So, 700 milligrams per day is the regular amount of regular calcium we need. So that would be 2 to 3 servings of calcium-rich foods a day, which could include your sardines, and it can also include your plant-based fortified calcium product that you're having. If you have been diagnosed with osteoporosis, the amount of calcium you need to take a day is almost doubled, up to 1,200 milligrams a day, which means you need to take at least 4 servings of calcium-rich foods per day. So it could be a plant-based yogurt or 2 that you add there, or if you're not having the plant-based options, a regular yogurt. One regular size yogurt is going to be 1 serving of calcium-rich foods. But sardines, if you like them, is a great way to get calcium too, because the bones are soft, you can crush them, and once you have them, they're going to give you a good amount of calcium as well. Vitamin D, it's kind of unusual, but it's true. We see a lot of vitamin deficiency in the Caribbean. I know it makes no sense, but we do see it, unfortunately. And we know that vitamin D is essential to be able to absorb calcium in the diet. So taking, vitamin D in your diet is very important. Not being afraid to sit, you don't have to sit in the direct sun, but you do need to be in the daylight for 30 minutes a day, but it isn't advisable to go between the hours of 11 and 2, but certainly later in the afternoon, stretching the legs, going for a walk, that daylight can help the body make its own vitamin D. Physical activity is very important. I know Raquella will talk about that, but we know it can reduce anxiety, irritability, and depression because it increases our endorphins. It's got many cardiovascular benefits. It helps keeps our bones strong, as we know, which is a direct result from menopause. It strengthens our heart and blood vessels. It improves our energy levels, our vitality, our general feeling of well-being, and it also helps boost our immune system. It's significant because it helps reduce our stress hormones. So when we're stressed, and if we're experiencing the symptoms of menopause, we might feel quite stressed, and the levels of cortisol will be quite high, which can contribute to the weight gain, but also makes us just generally feel anxious, more anxious. So, the endorphins that we produce when we exercise, these happy hormones, as we sometimes call them, can actually give us a great sense of well-being. And it's something that we can do fairly easily, and the benefits are many and significant. So 150 minutes per week is kind of the minimum expectation that we should do. So that would be 30 minutes, 5 days a week of the physical exercise side of things. And it can be taking your dog for a walk. It can be cutting the grass in the yard. It can be a variety of activities if you don't have the time to do the dedicated physical activity. Sleep is a big one. Because with the hot flashes at night, and as the video of the lady was saying, she's opening her quilt, she's closing her quilt, she's opening her quilt, and she can't get herself comfortable. And sometimes at nighttime is when we have less going on in our minds. During the day, we keep so busy running around, working, looking after the family, whatever it may be. And then it's at nighttime we start to notice some more of these symptoms. So it's important to do anything that you can to maintain good sleeping habits. Trying to go to bed at the same time every night, and trying to generally set your alarm, even on the weekends, to get up in and around the same time. Avoiding caffeine and alcohol, because this can impact the quality of the sleep. And developing a relaxing bedtime routine is important. There are many chamomile tea and things like this that you can take as well, that can kind of help get your mind into a sleep mode. We know that during menopause, the body fights the production of melatonin. Melatonin is a hormone that's produced that makes us feel sleepy and makes us want to go to sleep. So if our melatonin levels are starting to be suppressed, we're going to find it difficult to fall asleep. So, that is a direct result of the menopause that's happening in our bodies and the swings in the hormones. We know that people who get less than 5 hours of sleep per night on average are 40% more likely to become obese than those people who get 7 to 8 hours sleep per night. So anything you can do to protect your sleep as part of your healthy lifestyle is very, very important. So routine, staying off the screens an hour before bed at least, which is hard for some of us. Making sure the ambiance in the room is good, the lighting's good. There's nice essential oils sometimes that are worth burning, some nice lavender, some nice pillow mists. Anything that can really kind of get you sleeping better is going to have many health benefits. Also, your microbiome, which is what we call the bacterial families in the gut, it's very, very important to keep them healthy. And they get quite distressed, these bacteria, during menopause. So eating a high fiber diet and even sleep can impact the health of our microbiome. So, you know, it's important for many reasons, things we don't even think about sometimes. And just our general well-being. How many of us are happy when we haven't had enough sleep? I know I'm not anyway, for sure. You know, things just feel harder, you're more irritable, you just don't feel like you have the energy to do very much. So sleep is a big part of it. So in summary, you know, with the menopause, a healthy, balanced diet that includes, you know, the plant-based alternatives to protein to maintain your muscle mass, very important. Adequate calcium, adequate vitamin D, keep moving, keep active. If you have underlying conditions like high blood pressure or elevated cholesterol or even diabetes, good management of these is important. So as Dr. Campbell was saying, always go visit your doctor, be compliant with your medications so we can manage those conditions at the same time. And, you know, if you can implement some of these changes, it can have a general overall positive effect on your general well-being. So worth doing for sure. And there's our friend, the plate model again, which you can study more closely. I know there's so much we could talk about, but we only have a certain amount of time. But if anybody has any questions specific to nutrition or diet, menopause, or even not menopause, I'm happy to help answer them if you have any. Yes? Oh, thank you.
I have one question. When someone says you're insulin resistant, and then it's tied to polycystic ovarian syndrome, what does that mean in regards to diet? Because it's a bit still confusing and all over the place for me.
Yeah, good question. And it's quite common, actually. So the key thing there is the weight for the height, your BMI. The higher your body mass index, or the more overweight we are, the more resistant the body is to insulin. Now, it's not diabetes, but we manage it in a very similar way as we do with diabetes, in terms of we want to make sure we have a regular eating pattern. We want to do the physical activity. And we want to make sure that there's no added sugar in the diet. So even though you're not a diabetic, we still want to ensure as close to a no added sugar as possible. Now, no added sugar doesn't mean sugar-free. There are different meanings. There's lots of sugar that naturally occurs in food. That doesn't mean that we can't eat it. So people worry sometimes, can I have fruit? Can I eat mangoes? Can I have bananas? The answer is yes, of course you can. But it's when it's added, when you eat processed foods, ultra-processed foods, cakes or pastries, drinks, so drinks that have added sugar. And sometimes these fruit juice drinks, when we look a little more closely at them, there is a lot of added sugar, and they'll often be made from concentrate, which is a source of added sugar as well. So the words for sugar are brown sugar, white sugar, honey, agave, molasses. These words all mean added sugar. Any word ending in an OSE is an added sugar. So if you see dextrose, maltose, fructose, lactose, these are all forms of added sugar as well. Anything with the word syrup associated with it, so whether it's high fructose corn syrup, brown rice syrup, glucose syrup, these also mean added sugar. So one of the key things you want to do, as well as the other aspects of the healthy diet we spoke about, is be extra mindful of sugar. Because when you have insulin resistance, your body doesn't let the insulin work well in the body. And insulin is needed to transport the sugar out of the bloodstream and into the cells of the body. So if the insulin is not there, or it's there but it's not working, the sugar levels are going to climb. And so therefore we have to ensure that we don't let those levels get too high. And that's where that balanced diet, whole grains, and no added sugar becomes very important. Sometimes the doctor would start you on a medication like metformin. Miss Rosie knows much more about that than I do. But that can also help with the insulin usage in the body. So you approach it like you're diabetic, even though you're not, strictly speaking, a diabetic. But from a lifestyle perspective, we manage it in a similar way. Is that okay? Thank you.
Question from the audience.
Mhm.
Can fruits and vegetables be eaten together?
Oh, 100%. 100%, yeah. There sometimes is, let's call them myths or beliefs that certain foods cannot be eaten together, but our bodies are, as we know, are very sophisticated, and they know how to manage different kinds of foods at the same time, and the more mixed a diet is, in fact, the healthier it is. The more varied it is, the healthier it is. So I wouldn't worry about eating fruits and vegetables at the same time. It's all good news. And the fact that you're eating fruits and vegetables is extra good news. So,
All right. So my question is, though menopause is not a disease, have you ever received any referral from somebody who's going through menopause and needs support from the nutritionist or dietitian?
oh yes, many, many times. Dr. Campbell keeps me very busy. Because there's other issues often going on, and the weight gain is a big concern for many. And so people just want to know, are they eating the right kinds of foods? Is there anything we can do to improve? So sometimes it's a question of maybe encouraging more plant-based sources of protein. Sometimes it's including sources of omega-3. Sometimes, they may not realize the importance of the physical exercise side of things. So it's a combination of factors we would discuss, but definitely. And I did bring some leaflets that I will leave at the end. And if any of you want to schedule an appointment, there is some contact details on there, plus an outline of the kind of services that we offer in terms of our department. Thank you.
Thank you so much. Thank you so much, Ms. Simone Sheeham. You have done marvelously, because it's like she's an Adventist already. God be praised for the presentation that you gave. On behalf of the Savannah Seventh-day Adventist Church, and our ministerial leader, this is Pastor Franz Chambers and his wife, we thank you for your presentation, and also the Family Life Ministries, Men's Ministries, Women's Ministries, and Health Ministries. We thank you for being here. Thank you so much.
Thank you so much again, Mrs. Sheehan. All right, so you've been listening, and I'm going to test your listening skills. So I'm going to ask a few questions. I want you to get involved. Raise your hand if you think you know the answer, okay? Where's Elder Terry? Okay, right, he's ready. So you're going to raise your hand if you think you know the answer. So it's truth or error? Truth or? Error. Good. First one, menopause starts at the same age for every woman. Listen to me. Be disciplined children. Raise your hand. Whose hand went up first? We don't know? All right, so nobody's going to get the prize then, but you're correct. All right, you have to raise your hand, okay? Number two, and you're correct. Number two, you can't get pregnant during perimenopause. You cannot get pregnant. And you are correct. Very good. Number two. Sorry, you can. You can't get pregnant during perimenopause. That's false. So what did you say? Okay, good, good. We're on the same track. Very good. All right, next question. Menopause only causes hot flashes and night sweats. True or false? Let's use true and false here. Elder, which one? Elder, I'm going to fire you. You're not working. All right, so let's give a visitor the opportunity to answer. All right, so the question was, menopause only causes hot flashes and night sweats. True or false? False, very good. Give me one other symptom. One other. All right, yes, dry mouth, and they're behind me, wait again. All right, very good, you're listening. Okay, next question. Menopause only lasts for a year or two. Is that true or false? Okay. Elder? right, you're so brilliant. So menopause only lasts for a year or two. That's false. It's 1 year. So nobody gets the prize again. I'm gonna add another question. Okay, weight gain during the question again. Menopause only lasts for a year or two. It's 1 year, right? As in the cessation of, it's 1 year, isn't it so? Yes, 1 year, not 1 or 2, 1, right. The question is, I threw you off? All right, let me make up with another question. But you understand what I was asking, you right? Okay, okay. All right, come relax, relax. Okay, yeah, very attentive, very good, all right. I'm gonna make it up. Let me find one for you. Question. You can manage menopause symptoms with lifestyle changes. Yes, you can manage menopause symptoms with lifestyle changes. All right. Okay, Sister Barrett, true. All right, give me one example of a lifestyle change. I did that one. Balanced diet. Very good, very good. Okay, are we finished? Do you have one more? I could? Okay, one more. Let me just add one more. Menopause is the same as perimenopause. At the back, somebody. Okay, is it the same thing? Perimenopause and menopause? Not the same thing. What's the difference between the two? Anybody else can answer. What is Yes. And all right, perimenopause occurs before menopause, right? It's prior to. Very good. All right, I should have asked a gentleman a question, I want one of the gentlemen to answer to see. Gentlemen, stop looking away as you are talking to. All right, let me find a question for you. Only the men, only the men. I'm going to find an easy one for you. Give you a hard one? All right. Hormone replacement therapy is safe for every woman. You are disqualified because you can't answer any questions. All right, gentlemen in the... Okay, good. It's not safe for everyone. Fairly safe, but not for every woman. All right, very good. Clap yourselves. Very good. All right, so we're going to continue with our presentations. And next we have Mrs. Rosemary. Right, we have Mrs. Rosemary Bailey. She is a highly accomplished clinical pharmacist with over 30 years of experience in hospital pharmacy. She holds a Bachelor of Pharmacy honors degree from the University of Technology, Jamaica, and has a Master's in Clinical Pharmacy degree from the Robert Gordon University in Scotland. Rosemary is a Christian and attends the Bontown SDA Church, where she serves as the Health Ministries Director, Sabbath School Superintendent, Assistant Teacher for her teen class. She has one husband, they told me one husband, Sister Bailey. His name is Selvin, 2 children and 2 grandchildren. She will be presenting on natural remedies for managing menopause. And just before Mrs. Bailey comes, we're going to get part 2 to the video we started with prior to the previous presentation.
A friend of mine called me crying, saying that she thought she was going crazy. I asked her, why would you think that? She said she heard voices in her head. I could not understand. She heard voices. She swore that she was crazy. She was going out of her mind. She went into depression. And I think that's the worst depression I ever saw. And it was so sad because what you are going through, to me, is nothing compared to what I saw my friend going through. So, in this race of menopause, we just have to continue to pray, ask God for grace, ask Him to help us, give us the strength, because it takes not just us, but a community of us, a community of women, a community of men, to understand what this thing, menopause, puts on us women who decided to grow old gracefully. Thank you. Good night.
Good afternoon, everyone. Okay, so we've been sitting for a while, so I'm going to ask you to stand because I'm going to start with a word from the Bible. If you have your Bibles on your phone, or if you have your Bible, you can turn with me. It's Psalm 104, verse 14. Psalm 104 and verse 14. Well, 14 and 15. He causeth the grass to grow for the cattle, and herb for the service of man, that he may bring forth food out of the earth, and wine that maketh glad the heart of man, and oil to make his face to shine, and bread which strengtheneth man's heart. Okay, take a deep breath, and then you can sit. Thank you. So everybody is awake. Good. All right, so I will be sharing this afternoon on herbal remedies used in menopause. That's what I was asked to do. How do I do this now? Not change it? Okay. Will work? Okay. All right. So you notice that as we share, we do overlap. Yes? So we've been speaking about perimenopause a lot. And perimenopause is basically leading up to menopause. There's the decreased estrogen and the decreased progesterone, which doctor did mention as well, as our nutritionist, that we have fewer eggs, and the lining of the uterus, the endometrium, is less. We have shorter erratic cycles, and it's the leading up basically to the end of ovulation. And once we have menopause, we have said it so many times, what happens? Consider the complete after when? 12 months have passed without any ovulation. Okay, so I had a summary. We mentioned quite a few of them earlier. The physical symptoms that are seen. I don't think anybody mentioned hair loss. Did we hear hair loss? Okay, so that's another one to add. There's all the weight gain was mentioned several times, the brittle nails, the vaginal dryness, the sleep disorders, which includes the insomnia, dizziness. Did we hear dizziness? So there can be the dizziness as well as the ringing in the ears. Incontinence was mentioned. Yes. Allergies, breast pain. What about headaches? Yes. Joint pains, itchy skin. Well, the irregular periods we mentioned as well. Irregular heartbeats. Anybody? Osteoporosis was mentioned. So that comes under the physical symptoms. Then the psychological ones, the mood swings, the fatigue, depression was mentioned in the video and several times. Anxiety, the irritability is real. Or we'll say what, miserable? Yes. Difficulty concentrating, memory lapses. We spoke about the brain fog, but the memory lapses. Loss of libido. Would anybody care to explain that? We've been mentioning it. Loss of libido. Sorry? You can't be bothered. Okay, any other definition? No desire. No desire to walk? No appetite for sex. Okay, so it has decreased. In the digestive system, the digestive symptoms will have bloating, digestive problems, and the vasomotor symptoms, you'll have changes in the body odor, and that's where you get the hot flashes, right? So I learned this, I didn't know that the hot flashes is really an American term. And the hot flushes is UK, right? So it's one and the same. So it's hot flushes or hot flashes. Then, of course, the night sweats. The oral symptoms, we spoke about the dryness, but there can be burning on the tongue, and gum problems, increased bleeding from the mouth, gingivitis, and so on. The nervous system, you could get little sensation, little like pins and needles, electric shocks, and also tingling of the extremities. So of course these lists, they are not exhaustive because we're individuals and different persons will feel different things at different times. Okay, so some of these hormones Doctor mentioned. The cholesterol is one of the main lipids. Basically, it goes down to the pregnenolone, and from there you get the progesterone. So you have the progesterone, which leads to estrogen and testosterone, and all of this is like happening in the adrenal. The adrenal glands you find in the kidneys. Now, with the estrogen, you have like 3 different types: the estradiol, the estrenone, and the estriol. The estriol is the one that is like referred to like the love hormone, and that one is elevated during pregnancy. So based on that, that's how we come up with the herbs that we will use to assist. And it's important, and it has been mentioned several times, that menopause is not an illness. So just like how we would say, like when you're having your menstruation, it's not an illness. And some persons don't understand when it is so debilitating, and then there is so much pain where you have the dysmenorrhea and you can't go to work, you can't go to school because of the pain. So there are some women, as we've been hearing, that it can be quite, rather than just a smooth transition, not as gracious as you would imagine. So they've come up, these studies have been done on what we call the estrogenic herbs, or the estrogen increasing herbs. So it's because we've been talking about this imbalance with the hormones, and it's mainly this estrogen and progesterone. So both of them are affected. Both of them do go down, the progesterone a lot more, but the estrogen as well. And so this is why some of the herbs that were found in nature to increase the estrogen naturally. So this first one I'm sharing is Angelica. Anybody has ever heard of Angelica? So it's Angelica, Archangelica, or Angelica sinensis, or in the Chinese medicine, Dongquo. So this plant doesn't have any phytoestrogen. So this plant estrogen that we speak about that would help, but it does contain what we call coumarins, which will help to like thin the blood. So if you have an individual who is taking warfarin, then this we would not recommend Angelica for such an individual. And so when we speak of the herbs, they are medicines. Yes, they're not just to be, oh, we're just going to boil up some bush and, you know, my grandmother said so and so. They have medicinal properties because, as stated before, the herbs are for the healing of the nation and they're there for a purpose. So if you're not sick and if you're not going through menopause, some specific ones that, you know, will be used for the menopause, you would not use it because you're not in menopause, right? So it's a similar thing that happens, that you have to take these herbs in dosages, right? So if you have conventional medicines that you're taking, the herbs, we give them in particular doses. And so whatever is recommended, you do not take outside of those doses. Don't think that, well, my hot flashes or my brain fog is so bad, so I'm going to take a whole lot of herbs, right? I during the whole COVID scenario, one of my cousins, he said, you know, that he's going to take vervain because he heard that it's good for the immune system and so on. And he was like, well, how much are you taking? So he sent me a video with a whole pot of the herbs, literally no joke, a whole pot. And I'm like, but how much of it did you use? And say, well, the COVID gone. And yeah, but these things can affect your liver, it can affect your kidney. So this is why it's a particular dose. And for this particular herb that's on there, it can stimulate the uterus. So if it, like in a perimenopausal state, you'd want to ensure that you're not pregnant, right? So basically, there are precautions. Angelica is also used as a tonic for menopause, and the nervousness that I mentioned, the insomnia, the hot flashes, and the mental fog, this would be a good herb. There's also another one, that's the hops or the humulus. It also has estrogenic actions, and it's good for hot flashes and insomnia. This is a common one, sage. That's the Salvia officinalis. We use that in the kitchen. Yes. So it's good for the hot flashes, excessive sweating, heart palpitations, and sometimes you do get panic attacks. So that's a good herb for that. There's also another common one, the red clover. That's the trifolium. It has what we call the isoflavonoids or isoflavonones, which is similar to what is in soy. So it has phytoestrogenic properties, and these properties are quite strong. It's good. You see how colorful it is? It has a high mineral content, and it improves the bone and the cardiovascular health. You know, we mentioned that earlier, that you basically, during that time, you're going to have issues with your cardiovascular system, and thus you will eat healthy. And later on, you'll hear Raquel with the exercise portion. So you have to keep everything in tip-top shape. There's another one there, black cohosh. Anybody heard of the black cohosh? Yes, this is a North American herb. It's a native wildflower. It has been used for many, many years, like 2,000 years, and it's still widely used for the menopausal symptoms, mainly the hot flashes, the amenorrhea, in that absence of the menses, and it actually seems to mimic the estrogen. And the popular one here, soy. The soy has the same phytoestrogen properties, and it also has the isoflavonoids. Its milder symptoms are seen in individuals whose diet includes soy. So here I'll just share what happened to me when I went into menopause. So I was already a vegetarian, trying to be a vegan, but that is sometimes quite difficult. However, I was having my soy products, so what would happen is that I would just go shine, and the heat was still coming off. So Selvin would recognize it, and he says, "You're so hot." But I would just more be, the flush is there, but it wasn't like preventing me from sleeping or anything like that, but I knew it was happening. So what it's basically saying is that if you're already like on a plant-based diet, the symptoms can be much less. So it's not that I didn't have anything at all, but it wasn't like how I'm hearing people really complain about it. It wasn't so bad, but I knew that it was happening. Another popular one here is the flax. And flax will be twofold because, you know, as a part of your diet, that would be a good one to use because it's high in the phytoestrogen, and it helps to, I don't know if you remembered that Simone mentioned the bad cholesterol getting high with some of the fats. So this LDH, the low density lipoproteins, those are the ones that are considered bad, yes? So the flaxseed will help to reduce that, so we don't want those to be high in the body. Understood? Here's another one, licorice. We've heard of licorice. This is glycyrrhizal. It gives the adrenal support. It's an adrenal supporting herb, and it's also quite soothing. It has anti-inflammatory properties because you see all those long lists of things that can happen. Most of the pains and so would have some inflammation associated with it. And so this is quite a good herb, but we have to be cautious with it because licorice can actually cause water retention and thus would increase the blood pressure. So if you're already having issues of suffering from high blood pressure, licorice would be something that you would stick to a small amount or avoid, and we use another herb. So we would use cautiously. And that's what it looks like, and most times we use the root as well. Now, remember we're talking about those two main hormones. This is the progesterone ones, and I'm sure you would have heard of this, the wild yam. That's the Diascorea. So it contains the sterols and saponins, and it resembles the actual progesterone in our bodies, that hormone. Another one, Vitex. We've heard of chaste tree berry, so the Vitus angus cactus. It's a hormone regulator, and it's something that happens with herbs. They work more in synergy with your body, right? So if, say for example, you're in, because it's used to if you're not in menopause, right? So if you have hormonal issues during your menses, like if you have terrible pains, terrible cramps, the chaste tree helps to regulate that. And if you're in menopause and having hot flushes, and so it's able to do that. So it balances the pituitary, and that's in the brain, and particularly the HPA axis. So what happens there is that that's between the brain and your kidneys. So that's the hypothalamus and the pituitary and the adrenal. So there's a whole regulation going on there. So anxiety is associated with both, so you see it's right there, the PMS, so if you're having menstruation or during the menopause, but you cannot use it if you're pregnant, which would not be the case if you're in menopause. Am I going back? Okay, so soy also contains the saponins that resembles the progesterone. So, however, it predominantly is used to increase the estrogen. So soy has both benefits, but it's more so for the estrogen. And I know Simone mentioned something about like the jury is still out on whether the soy is going to be definitely be increasing your risk of breast cancers. What we're understanding now in the herbal world is that when you spray the soy plants with Roundup, I think it's called, so that pesticide, that's when you're more at risk. So that's why we're looking for organically grown, and hopefully they're telling the truth. So we'd want to look for the organically grown soy. Yes, because that is where the problem was coming from in the first place. And so that's why the plant on its own, they're not able to find enough to say that, no, it's definitely doing that. So it does have the benefits. Now, because we spoke so much about the hot flashes and hot flushes and so on, there are some types of herbs that we mentioned that I'll mention here. We call them warming herbs. And I have a list there. And just think of it, if you had a child or if you were having a fever, what is it that we would want to do? If someone was having a fever, be it a child or an adult, what would we want to do? We would want to cool them down. And so years ago, we used to say, all right, you wash them down with alcohol and so on. But we don't do that much anymore. We don't do that. We don't recommend that. So we use water. We use hydrotherapy because it's bringing down the fever too suddenly. And you probably, if you don't have a thermometer, you're getting a false sense that the person is already just so cool because the alcohol is so cooling on the outside. Well, we have similar things that the herbs can do, and you would probably think that if you're feeling hot, you don't want to drink something hot. But if you do have something hot, you stay cooler for a longer time. So if you do have soup on a hot day, which we do have soups in the summer, we feel cooler longer. So that's the kind of thinking. It's like a conundrum, but that's what happens with the warming herbs. So we have like sarsaparilla, similax, helonias, sage is in that list, cinnamon and ginger. We know ginger to be hot. The warming herbs also continues there. Ginseng, I use the more common names there. Sassafras, angelica, yarrow, rhodiola, and peppermint. So peppermint can be warming and cooling as well. And more on, well, the black mint, they say, is more warming. There is mallow, there's licorice, that's the cooling herbs now. So the licorice, the chamomile, ashwagandha, elderflower, lemon balm, the chickweed, spearmint, rose, violet, linden, and oats, the milky tops. So some of those are cooling herbs. So you can use the warm ones at time, because if you notice, you're going through hot and cold, and some of these are the cooling ones. So this is an important thing about the herbs. We hardly use, I see I had a list there, we hardly use individual herbs, just like single. We tend to make formulas, yes? So each herb is going to support the other one. So it's a sort of, not a sort of, it is a synergistic effect that we support. So this is a little formula here. This is an example. Like for hot flushes, we would combine black cohosh, wild sarsaparilla, hops, and some ginseng. And this is another reason why we would not want to be doing these things on our own. You need to get the advice from a herbal specialist and to ensure that it's being done properly. So you don't just go out and just pick up a whole bunch of herbs and just throw it in a pot. Because we usually do this as like a tea, or we use tinctures, which they do use alcohol to extract them, but you're using just a few drops. So it's not like to get you drunk or anything. It's because the constituents in the herbs, if you were to use water, or sometimes we do use glycerin for especially the children, but most of the constituents do come out using alcohol. So it's a diluted alcohol solution, and then it's extracted and you tip it into water. So you use it as we call it a tea, a herbal blend, where you can have, like when you saw the photo that I showed with the roots we use a decoction, while if you're using the softer parts of the plants, then we will use it as an infusion, which is what we do when we're making a hot drink. You just throw the hot water on it, and we say we allow it to steep, yes? Okay, so another example of the formulae, for like emotional swings, we can use the vervain. So I mentioned the vervain with improving the immune system and so on. So we have the vervain, the wild yam, the chaste tree berry, the St. John's wort, and lemon balm. We know any of these herbs? Okay, so we speak now of, remember I spoke earlier about the estrogen and the progesterone, and this is the adrenal nourishment in menopause, because we're looking at the whole cycle. So if the endocrine system registers an emergency or a stressful situation, then the body adjusts to protect itself. So self-protective symptoms, so you'd have increased heartbeat, the pupils will dilate, there's redirection of the blood flow and energy from the periphery to the heart. So the periphery is all the areas that's not attached to the brain and the spinal column. And there's rapid breathing and muscle contraction. Then comes fatigue and confusion. Doesn't that sound a lot like menopause? Yes, so these are the same symptoms that can affect the menopausal woman. Okay, so as a woman, you are a wife, a mother, a grandmother, yes? And then some of us are in the executive, we're into politics, just being professional and having to do all of these things and still be able to manage and cope. So some of the herbs that we use to nourish the adrenals is the lemon balm, which I mentioned earlier, which is the melissa. We have the licorice, the vervain, and the black cohosh. So these herbs will help with that anxiety and if there is scattered thinking. The lemon balm I mentioned, is melissa. This is a really good herb. It's quite effective for focus and restlessness and also for panic attack. And the good thing about the lemon balm is that It's a very mild herb, and you can use it for a long time, a longer period. And we have, this is a category of herbs, the nervines. And if you notice, I mentioned that you can have like electric shock in the system and so on. So this would be a good tonic for it. Beneficial effects on the nervous system once you use a nervine. So the Avena sativa is our oats. You could have frazzled nerves or exhaustion or weepy. You could, just be crying for no reason. This herb is another good one to use, and we would put that in a formula. Then you have sedatives. Remember, we mentioned that you have problems sleeping, and there is some amount of anxiety. So herbs that reduce anxiety and help to promote a restful sleep would be like our chamomile. I know we're familiar with the chamomile because a number of persons will buy that again as a herbal, dried herb. There's a valerian and also hops. We mentioned the hops before. And for the night hot flashes, anger, and so on, we have the rose and ashwagandha. We've heard about ashwagandha, right? So that one is a very good one for the toning. It's very good for stress. Then we'll have another category, the hepatics. And this is hepatic is coming from the liver. So this is a herb that is it's a wide range of ways that it can help with the work on the liver. And the liver is very good for removing toxins from the body. And so there is the toning and the strengthening, and it increases the flow of bile. So some of the herbs that will help is the motherwort, the burdock root, the dandelion root, and the milk thistle. These are very good for cleansing. Okay. Thank you. I did it in time. Okay, thank you for listening. And as I would just like to share, for those who are Adventists, you know about the New Start, but we have been trying to promote the celebrations because that's where we're going. So we make healthier choices. We're going to do our exercise, make sure we're well hydrated, have our environment clean, have our strong beliefs in God, make sure again we keep hearing the rest, getting our fresh air, making sure whatever we do that's good for us is in moderation. So I spoke about the herbs, so you're not going to overdo it. And just maintain your integrity, be optimistic even though you might be menopausal. Get your proper nutrition and come to sessions like these where you can get your social support. Thank you.
Thank you so much, Sister Rosemary. We have one quick question. In the meantime, I'm going to ask the person. Thank you so much, Sister Rosemary. We're going to take one quick question because time is now against us. In the meantime, I'm going to ask the person who will be presenting a gift to Sister Rosemary to make her way. Go ahead, Kuda.
All right. Thank you, Sister Rosemary. Good presentation. In terms of the vitamins and supplements that are found in the pharmacy compared to what you're talking about, should we just go get those from the pharmacy, or do you recommend maybe coming to you with that expertise to get those vitamins compared to the ones that are made on mass production, the synthetic vitamins?
Okay, and I know Doctor mentioned it as well, because whatever you do, one, if you're being seen by a physician, make sure you discuss it with them. The things that are in the pharmacies did mention, they still go through that synthetic process. The ones that I'm talking about, these are like using the whole plant, just using just the natural stuff. This is not, it doesn't have any, it's not going through a process. It's using the whole plant. So but we have choices. So if you do go to the pharmacy to choose something, I would recommend that you make sure that there is nothing there with the gelatin, because if we want to go like to a plant-based diet, and so the gelatin is usually made from animal products. So you could ask the pharmacist to assist as well to make sure that whatever you're choosing, but they do go through a rigorous manufacturing process as well to ensure that it's safe. Okay, so presently we're dealing in the clinic that we do have at the health services, we're dealing with specific things. So we're dealing with the anxiety, low energy, sleep, and pain. So if it's related to that, then we will be able to do that. But I can make a recommendation if you're going to purchase them elsewhere.
Question?
Yes.
Okay, for the herbs, right? In the pharmacy, we have the drugs or the medication that is in a controlled environment, so the dosage is controlled. What sort of control? Well, maybe your pharmacy might have it in control, but you have some people who come and say, oh, my granny said I must use this and that and that. What sort of control we can get in terms of the dosage? Because the herbs might be good, but we might be taking over the amount.
And so that's the recommendation I was making earlier, that you'll have to seek help. I can assist, or if you know another herbal practitioner that could assist you. But most times, if you were to buy it from Himalayas or any of these other places, they do have doses on them that you should stick to. But if you were going to like pick something from your garden, like say the peppermint then, you're still not going to use like 6 leaves or 6 of the big stem.
Or 8
mango leaves. Right. So most times, that's as a guide. If you're picking something from your garden that you think is a simple herb, it's actually more potent when it's dry. So if you have the fresh herb, it's like 5 leaves, 3 to 5 leaves in 8 ounces of water. Just a cup. And the dried one, you can use a similar amount, yes, but you just know that it's stronger. You can use 8 ounces of water. So it's a cup.
Sister Rosemary, you must all agree that we have experts here. We are so thankful for you to come here this evening to share with us your expertise. And I know that we have learned a lot this evening, and we'll try as much as we can. You know, some of them don't seem real. A gardener came to my house, and I was asking him about leaves, because he said his grandmother grew him, and he knows. So he was telling me no more than 3 leaves, 3 of this, 3 of this, 3 of this. So that is a combination of 9 different leaves together, no more than, I don't know if that is true. So it's true, all right. So it's, it's true, all right. So we thank you very much, and this is just a token of our appreciation, and it's from the family ministries, the health ministries, our pastors, and our... But family ministry include women and men, right? Right, so that's why I say family ministry. Family ministry, our health ministries, our pastors, our... Right, and the church, okay? Right, all the members of the church. Right, so this is not an indication of what you did. It's just a token of our appreciation.
Thank you for having me.
You're very welcome, and you'll be back.
All right, thank you again, Mrs. Bailey, for your presentation. And we're down to our last presentation. I know we're running a little bit behind. We're behind time, but just bear with us. It's the last presentation. Okay, so we have Dr. Raquel Smith. Most of us know her. She's a seasoned physiotherapist with over 2 decades of experience in helping patients recover from injuries and improve their quality of life. She earned her first degree in physiotherapy at the School of Physiotherapy in Kingston, Jamaica. Then she completed her doctorate in physical therapy at the University of St. Augustine in Florida, US. She has since worked at the HSA, and she now manages the therapy services department of physiotherapists. And I'm going to cut it short. She's married. She has 2 boys, 2 dogs, and 2 cats. She enjoys reading, cooking, eating, and getting in touch with her friends, both old and new. She loves the Lord, so help me to welcome Dr. Raquel Smith as she presents on exercise and strength training.
So, I'm the last one to present and everybody's tired, but nevertheless, I'll sit down and wait for that video presentation on the screen first. Yes? She's going first? Or after? Before?
Menopause is a normal phase of life for women, but for many, it's not the case. I had the unusual experience of entering that phase of life in my 30s when, by surprise, 2 doctors diagnosed me as being perimenopausal. This was supported by medical tests. Other than those tests, I had no symptoms. At that time, we had only 1 child, and the second was evading us. The doctor also advised that any other would have been highly unlikely. The physical evidence eventually started, and the usual experiences of hot flushes, sense of unwellness, memory challenges, and the fluctuation in my blood pressure eventually came. I am, however, thankful to God that my symptoms are not as aggressive as others are, and also we are thankful for the miracle He gave us of a second child during this unlikely season.
Right, so I want to share a small part of my menopause story. I remember speaking to a girlfriend saying, you know, I must have a virus or something because, ever so often I'll just feel hot, then the next time I'm not. And she laughed me to scorn and says, Raquel, it's hot flushes. And ever since then, our secret code for what's happening with menopause is she'll ask me, so how's the virus? But, as I think about menopause and as all the various presenters said before, that it affects so many different parts of our bodies. It is like a virus. But for my presentation, I'll be talking about strength training, resistance training in particular, and why it's really vital for us in the menopausal years. Okay. Right. Okay, so I will briefly cover, and it will be a repeat, how menopause affects our bodies, how strength training can help, and just touch very briefly on effective strength training. So, as you've heard before, but repetition helps, that with menopause we have this sudden drop in a lot of these very beneficial hormones, estrogen primarily, but also progesterone and even female testosterone. And menopause, estrogen rather, has a very protective effect on our bodies. So when it goes, most things goes south, and we have all of these problems that we now have to deal with. So we have cortisol and other stress hormones become more active as the levels of estrogen gradually diminish. And then we have other pro-inflammatory agents. They become more destructive. Before, estrogen had a protective effect on all of those various agents that were always there, but as the levels of estrogen are decreasing, then they can now wreak their havoc on our bodies. In fact, menopause is sometimes described as an inflammatory event rather. And this internal trend towards chronic systemic inflammation can affect many organ systems, as all the other presenters shared with you. I will not be discussing all of these. I want to touch specifically on the ones that strength training can benefit. Although decreasing our libidos and all of that, strength training can have a knock-on effect, which I will touch on if I get the time. So osteoporosis, basically dry, brittle bones, and estrogen normally slows down the breakdown of bone. But in its absence, the bones become brittle. Women are far more likely to develop osteoporosis than men because they have this sudden drop in estrogen. 40 to 50% of postmenopausal women, and that's a really horrifying number, will have a fracture due to osteoporosis at some point in their lives. And hip fractures are especially concerning, as one study showed that 1 in 3 adults aged 65 or older usually will die within 12 months of a hip fracture. As a physiotherapist, I do often see these tend to be older women, and they were walking before, and they get a hip fracture, and some of them never get back up again and become ambulant again. They end up, their mobility impaired, they can no longer walk on their own, and of course, their bone density falls even further because there's no load bearing, and their lives are completely affected. So, weight training is a load-bearing activity, and that's one of the reasons why when we enter menopause, strength training becomes a key component of our lives going forward because of that load-bearing benefit. As we load the bone, it adapts to build more bone cells, basically. And I'll go into that a little bit further. So coronary artery disease. Let me see if I put on my glasses, I can actually see it better. Not related to menopause, but one of those changes as we are growing old gracefully. Okay, so interestingly enough, coronary artery disease is a leading cause of death in women. And yeah, my eyes are really gone because I can't see what's ahead of me. I'll have to turn here. So what I have there on the screen is that decrease in estrogen and progesterone result in our blood vessels constricting a little bit more. The liver begins producing more proteins that can cause the blood to clot. There are certain cells within the blood vessel themselves that are less effective at ensuring blood flow. So you have an increasing chance for blood clots and threats to heart health. So you have all of these things happening. Strength training can help reduce high blood pressure and cholesterol levels. There are various studies on this. Studies suggest that lifting weights, even for less than an hour a week, can reduce the risk factors of heart attacks or strokes by 40 to 70% when you consider all the various things that are happening simply because of decrease in these sex hormones. Lots of things. Talking about metabolic changes, and it's true, many women can gain an average of about 25 pounds between perimenopause and postmenopause. And so sometimes you'll see ladies, they put on a little bit of weight. It's not because they're eating more or they've become lazier or, you know, they're eating too much sugar, it can simply be due to these metabolic changes that we're all experiencing. So ladies and gentlemen, this is not the time to go up to your sister and say, oh, wow, you're put on a little bit of weight, aren't you? I mean, we don't need to hear that. We're dealing with the effects of menopause, and that is just going to make us more anxious and feel less about ourselves. So that is not the time to remark on somebody's weight gain. So as estrogen decreases, the body attempts to make more estrogen by increasing your fat cells. And for some reason, it tends to be more around, you know, the abdominal fat. And that's commonly referred to as visceral fat, and it's in fact more harmful than fat distributed elsewhere. So because of this as well, the body becomes less sensitive, as Savannah, the nutritionist, mentioned, less responsive to insulin, leading to higher blood sugar levels. For those of us with polycystic ovarian syndrome, you may already be less sensitive to insulin because of PCOS, that's what it's referred to. So when we enter the menopausal years, then it just doubles the reduced sensitivity to insulin, and that furthers the weight gain and can lead to type 2 diabetes, coronary artery heart disease, and stroke. See why I see it's a virus affecting us? Okay, so why weight training? It instructs the body to build more muscle. And muscle is very sensitive to insulin in comparison to fat cells. So when we have more lean muscle, we are less likely to end up with type 2 diabetes and other metabolic diseases. And as it says there, muscle is more metabolically active than fat. So the body burns more calories at rest, resulting in a leaner body. So somebody who has a lot of lean body mass. So there could be two ladies standing in front of you, and they both weigh 160 pounds. And one of those ladies could be quite fat, and another one is lean and muscular, because muscle tends to weigh more than fat, and their bodies can look very different, both at 160 pounds. And the benefits of having that lean muscle mass as well is that whereas when we sit down to Sabbath lunch, I can eat, 2 plates of food because I have all this lean muscle mass. Muscle is more metabolically active. I can eat more, have a higher metabolic rate. When we are obese, we have less muscles than we can eat 1 corn, and it becomes a problem. Okay? So benefits of having lean muscle mass that we can get from weight training. Okay, we also want to talk about sarcopenia, which is loss of muscle tissue. And there's a comparison there of gentlemen with nicely toned muscles in comparison to when all of that muscle is gone. Strength, right, so I want to first look at, again, estrogen has a role in muscle tissue maintenance. When it goes, we begin to lose muscle. So it's after age 30, we lose 3 to 5% of muscle mass each decade, and following menopause, up to 10%. So with that, when we lose our muscle, it is leading to decrease in strength and function. This is where we are more likely to suffer a fall. And again, because our bones can be more brittle in these years, before, when you suffered a fall, you kind of just dust yourself off and got back up again. Your bones are now brittle, so you have a fracture leading to some of the effects that we spoke about before. So it's a sequelae of events. So we want to weight train, to build back, to get muscle, to counteract the muscle that we're losing. as we age and because of menopause. So we also want to talk about neuroinflammation. I mentioned before that menopause in some circles is described as an inflammatory event. It also affects our brain cells. So the dramatic hormone changes during menopause can and does affect our brain cells. And when the inflammation becomes chronic, it can lead to formation of plaques. Some of them are associated with Alzheimer's disease. That was really sobering for me. Not only am I going to feel hot at night and I'm going to gain weight, but I could end up with Alzheimer's disease. It increases the risk of that. Women, as a result, are more likely to be affected, as you know, by anxiety and depression and other cognition-related disorders, such as multiple sclerosis. There was this interesting study done by University of Sydney that found that strength training can help to protect the brain from degeneration. And I think within a 6-month period, 6 months of strength training, that slowed and even reduced the development of plaques that are associated with Alzheimer's disease. So there are different forms of strength or resistive training. What you see there on the screen is body weight. I'm not telling you that you have to buy a gym membership. Certainly not. You can use your own body weight to apply strength training. There are inexpensive resistive bands that you could use at home. And of course, you could pursue a gym membership or even to have weights at home. So, for it to be effective, because sometimes you're driving along and you see someone, with some pink dumbbells walking along the road, and they're kind of doing that. That is not strength training. Definitely not. For strength training to be effective, you need to lift as heavy as you can, safely. If you have never lifted, then of course you're not going to all of a sudden, pick up 60 pounds and try and do a biceps curl. But it should be difficult for you to do, say, if you're doing 10 reps, by the time you have gotten to 8, 9, 10, that, you have to struggle to complete those reps. You want to train at least 2 to 3 times a week. And as you said, you're lifting heavily because you're telling your body to adapt to the stress you are putting on it by building more muscle. So you need to lift heavy, safely. I keep saying safely because that is important. I have their lower rep ranges. So say you're doing 3 sets of biceps curls, then you want to be working within the range of, say, 6 to 12 reps. If you are using a weight that you could do 20, 30 reps, then you're just doing cardio with some light weights. And that's not what we're talking about. We're talking about weight training. Progressive overload, what is that? This week, when you're doing your biceps curls, you can use 10 pounds. And you're using, say, 3 sets of 10 using your 10 pounds. Within a week or 2, you could try and do 12 reps with your 10 pounds. Or you could, progressive overload can be applied in different ways, either by increasing the weight that you're using, and within that low rep range, increasing your repetitions. So you could either, within 2 weeks, you could try and do 3 sets of 12 instead of 3 sets of 10. Or you could say, you know what, I am going to try to see if I could do 3 sets of 10 with 12 pounds. But you're always trying to progressively overload the weights that you're lifting to force the body to adapt. And what the adaptation you want is more muscle. And proper nutrition is important, which Simone spoke about, having a healthy amount of proteins, carbs, and healthy fats. I have that lady on the screen. Some of you may be thinking, I'm not really interested, or it's too late for me. Joan McDonald, at the time of that picture, she was 74 years old. It's never too late to begin. And you could see her there, the picture to my right, I guess it would be your left, where she started. And look at her now. So it's never too late. And that was my short presentation on strength training. Thank you very much.
We can, okay.
Yes.
Thank you so much for your presentation. Very exciting. I have the weights at home. I just need to use them, right?
Yes, you do.
Okay. I want to find out if in your practice, if you are aware of the yoni stones, like if the patient or the client has atrophy in the vaginal area. I have heard about them, and like their little egg shape, emerald shape, if we use that rather than doing surgery.
So she's talking about one of the things that we deal with as well would be urinary incontinence, where with coughing or sneezing, any form of increased pressure, abdominal pressure, that we may leak urine to various degrees. Before moving to surgery, as physiotherapists, we do teach pelvic floor exercises. And also, we can use weights, one of which would be the yoni stones, to insert into the vagina where the client will hold it in against that weight. So it's resistive training, particularly for the pelvic floor muscles.
I am so happy I waited for this last presentation because it was really worth the wait. And I want to say thank you so much, Dr. Smith. My question, and I think it touched base with the question I had previously in terms of the elasticity, losing that elasticity. But I'm asking, I just heard you, I'm going home. What can I do with what I have home? Is it that I find that 5-pound flour jar and start to lift? What is it that we can do if we do not have anything home and we want to start now?
What you are taking home with you is your body. I spoke about body weight exercises. You don't need anything else. You have never lifted before. That would be a great place to start. Using your body weight to add resistive training. This presentation does not allow me to go into specific exercises, but that's something I would be happy to provide at another session.
Hi, thanks as well. What if you have abdominal hernia or so? Do you recommend all kind of strength training, or should it be used tentatively?
Right. So it's always beneficial before you start any exercise program to check with your doctor to see what is safe for you. So, but even with a hernia, strength training can still be included, but they're just safe ways of doing so. Yeah. It's not a no-no, definitely not. I myself, talking further about my journey, is yes, I've gained weight. And so I'm really pursuing strength training, and I absolutely love it. Hopefully, I will look like Joan in a little while. But even before I get to that point, I feel so empowered because I'm able to lift things for myself. When I travel, I'm able to lift that suitcase up into the overhead compartment. We have dogs. I go to Foster's and I pick up that 40-pound bag and I'm able to do it. It's very empowering. And talking about things that have a knock-on effect is that when I exercise, when I weight train, I have release of all of those endorphins that places me in a much better frame of mind. When I go to the gym, but I work out at home as well. It's my time. And Dr. Campbell spoke about rest, and rest is not necessarily just sitting down and doing nothing, but it's time away from what you're normally involved in to give yourself space, to have space for yourself, self-care. So for all of those reasons, and it does affect, improves one's interest in sex, so many beneficial effects.
Good evening, and this was an excellent, I'm glad I came for this presentation. There needs to be a part 2. When you think about the balance, when we are prone to injury, as you mentioned earlier, we're having joint aches and pains, and now we're thinking about exercise. I think swimming and also using, not weights, but to use water as resistance, aquarobics. I've seen a few older women at the ocean, light weights that they can use in the ocean, resources all around us, and that too is beneficial, along with Pilates as an option as well. Just wanted to just mention those two.
Right, so there are many forms of exercise. What you just spoke about, well, excluding Pilates, are more cardio forms of exercise, and yes, they're all beneficial for heart health. But I specifically spoke about strength training because we want to get that adaptation where we are building lean muscle. That is key in managing many of the symptoms that we spoke about. So all forms of exercise are beneficial, but specifically to increasing lean muscle mass, which is more adaptive to insulin, load bearing, all of those things, I really encourage some form of weight training.
All right, so on on behalf of the Family Life Ministry, Women's Ministry, and all the other ministries of the church, I would like to take a moment to express our sincere thanks for taking the time to share your knowledge and insight on such an important topic. And I know I'm young and I'm not at that stage of my life yet, but your presentation was very informative, and we're truly appreciative of your presentation. Thank you.
Thank you so much, Dr. Smith and Roxanne. And thank you so much for being so patient. We're now down to the end of our symposium, and I'm going to call on Kuda to do our vote of thanks.
Thank you. So let's rate the symposium out of 1 to 10, 10 being the highest. What's your score overall? Oh, all right. There you go. So that means we have a part 2 coming up and a part 3. There's so much more to discuss. But thank you so much for being patient with us. We appreciate your presence. So thank you, first of all, to our participants, our attendees. Thank you so much for coming. We have to give thanks to our Lord God Almighty for allowing us to have a beautiful day. It looked a little cloudy. I think we had some rain, but it happened, and we are happy for that. So thank you Father, for allowing this day, and I know that we would have learned so many different aspects to menopause. To our video experiences, Judine, Charmaine, Hopal, and Angeline, I think we may have one more to share. Thank you for being so brave to present your experiences. I can say that sometimes menopause is really brutal. Our presenters, Dr. Leroy Campbell, he left, but he was very interactive and, eye-opener to all the things. I think starting from the beginning, where eggs, the process of losing them over time and how to treat it. To Simone Sheehan, our registered dietitian, who gave us an overview of how to manage menopause and what we need the foods we can have to improve our symptoms. Sister Rosemary Bailey with registered pharmacy, she's always willing to do presentations. She told us about how the herbs that we can use. And my husband is always very critical about boiling the herbs and how much to drink because of the effects on the liver. So now you have concretized that point, you have solidified that point that no, you should not just go boil herbs. So mommy, you hear that? No boiling of herbs. To Sister Dr. Raquel Smith, thank you so much for that presentation. And we have some weights at the back. They're not for the taking. So I need to go home and use them because I brought them, so I'll take them back. And Cheryl has hers. So thank you for those presentations. To the departments, I want to say thank you, Sister Blake and Brother Blake. They brought the idea, and as we realize, we need to continue to have more of these discussions. So to the Family Life Ministries, Brother and Sister Blake, who headed that in terms of the initiation and continuous planning, and their team, thank you. Women's Ministry, Sister Selena and her team. Men's Ministry, Brother Andre and his team. Health Ministry, Sister Millicent, Sister Natalie, and Arlene, who helped to select the topics and the presenters. Thank you so much for that. Sister Kashina Bennett for the display that's on the outside. And just to let you know, we have some passports out there for women. You may take one. It just indicates to you or show you the tests that you need to do. Some tests that will help you as you get older, especially we've been talking about the cholesterol, so you can just pick one from the booth. Sister Tanik for the refreshments. I think we may still have, I'm not sure. But okay, so before you leave, you need to go to the hall and get your refreshments before you go. Communication, Brother Colley and his team, thank you so much for ensuring that we're all audible, the slides showing and all. And online, thank you to our online viewers for sticking with us. I know persons were asking, where's the link? So it went out. Thank you so much for that. Sister Charmaine, Sister Dacia, thank you for facilitating. I hope I have not left out anyone, but if I have, please forgive me. And I have to recognize, I'm looking at her in that bright orange. Remind me of the name? Coralie. Yes, that's the voice on the video ad. Thank you for sharing with us today, and thank you for doing the ad. On behalf of all the 4 ministries, I want to say thank you, and we will be planning another one. It's evident that we have to. So thank you for coming, and I pray that you will have a safe trip home. I'm sure there's something else coming. Oh, closing prayer, okay.
Shall we stand for prayer? Let us pray. Kind Father, we're grateful that you have blessed us with such amazing bodies. Lord, because of sin, we have so many experiences that you never intended for us, but we're grateful that you've given us the wisdom and the knowledge to apply things that will make this experience a lot better. We're grateful, dear Father, that we've come this evening and we have gathered some information that we can use to help reduce symptoms, and to prepare for this period, this very important period of time. Father, we also want to pray for the men who are present. We pray that as they would have also experienced through what is shared, what their wives and mothers and sisters and whoever else face, Father, help that they will be supportive in the process as well, as best as they know how. Father, thank you for the presenters. Thank you for their clarity. Father, thank you for our minds. We pray that you will help us to remember the key things that we will need to take away. And Father, take us safely to our next destination as we say thanks in Jesus' name. Amen. You may be seated.
Okay, thank you so much for attending. And as was mentioned before, refreshments are served in the church hall. Brother Colley, could you play the last? Oh, we had an issue with that. Okay, we just had one more video that we were going to play for those who want to watch, but we are having some technical difficulties. So thank you so much, everyone, and do have a good rest of your Sunday evening and a great week.